Yeah, but also, when does ADHD become a disability and then a superpower?
It's a superpower.
Or is it always both?
I think it's both. Depends on what you're doing.
Yeah, but a lot of people use it as a crutch.
Yeah, that's bullshit. I think for our jobs, you have to have some ADHD or you would not succeed.
In what facet?
I think in emergency medicine, you have to be able to look at the whole forest and be like, ooh, there's a shiny one. I want to do that one right now. And if you were like an OCD ICU type person, you would be looking at it like, ooh, there's one tree and I can't see anything else happening.
I haven't really narrowed it down to being the ADHD, but there's obviously people around me that are way more book smart, but then they perform, and it's taken me a while to say this out loud, but like they perform so much less better, so much less significantly than me. So I think maybe it's that. I don't know. Why can they pass all these tests? Why can they have all these degrees, but yet they can't run basic calls? Is that the ADHD?
I think the ADHD lets you pick the important one and not get stuck on like, I need to untangle my cords. You know, like OCD people, they want it all untangled, right?
Yeah,
they have to like, they have a stepwise approach. Whereas we're like, oh no, that needs me. Oh no, that's more important. And they are more like, I need to start from A, B, C, D, E and go to the end.
Yeah, but do you have that also?
A little bit. It kind of depends.
Can OCD, like, what's the thing where
There's
you
overlap
go
for sure.
to, like, when I close the garage, I run back maybe 2 or 3 times, and it costs me like 8 minutes in the morning.
Yeah.
Is that OCD?
Yeah.
Yeah. So maybe I have both.
You can have both. I mean, neurodivergence in general, like, overlaps oftentimes. They all kind of fall in the same bucket, and you can have, like, your own. It's kind of like mixing paint. Like, you have a little more red, then a little more green, and a little more blue than somebody else.
Okay. Well, so neurodivergent is that term that's like a blanket umbrella that they tried to, because they were getting tired of people saying autistic.
Yeah.
So they're like, just say they're neurodivergent.
Yeah, and I think neurodivergence really encompasses all of the things, right? It like puts them all in a bucket of like, you're not John Smith who can wake up at the same time every day, do the mail, function normally, whereas neurodivergence is like it can be ADHD, OCD, I don't know. All the things.
I heard a term, totally don't want to get us in trouble, but apparently you're allowed to say retarded adjacent now.
What?
Yeah, as long as you add the adjacent.
What?
I don't know. That's what I was told by a medical professional.
I was like, was it a firefighter?
Well, okay, kind of. But they also have another medical degree. But they said as long as you say adjacent, that you can say it now.
I'd like to watch you try that.
I'd say it all the time, but I'm not a good person. But I'm working on it. But I do. I now go out of my way to make sure I say the adjacent part too.
I'm curious how that goes. I'm going to have to look into that.
Anyway, Allie, thank you so much for doing this. I really appreciate it.
Yeah.
Means a lot. When did becoming in healthcare come on your radar initially?
I feel like definitely my sophomore year of high school, I was in just like an anatomy class or some sort of science class that we were dissecting frogs. And I was like, meh, this is pretty cool. My grandfather, my mom's dad, was a frontline surgeon in World War II. I'm so bad with dates. He actually worked with Dr. DeBakey, who is the surgeon who did the first heart transplant, to my knowledge. And there's actually a clamp used in surgery named after Dr. DeBakey. It's called a DeBakey clamp. My grandfather worked with him. He actually wanted my grandfather to go back to Texas to work with him. And he's like, we grew up in a small town called Marshall, Missouri. And he wanted to go back there and just continue being the family doc. And that's what he did. And then his dad was some other kind of doctor. He worked at MIT. He was in the military. He actually worked on the team that helped develop the first preservatives so they could preserve blood. I didn't get to meet any of these people. They were all dead before I got here, but I've heard stories.
Did you go to nursing school right out of high school?
I did. I went to...
You don't have to apologize.
Okay.
It's fine.
I did. I had thought about actually doing pharmacy, but I'm kind of a people person. I was like, I'm going to get bored to death if I'm just sitting here like counting pills. And so nursing was it. I considered med school, but honestly, like, I didn't grow up well off. Like, my mom was a waitress. We were on food stamps. Like, we didn't have a lot of extra. And so it just didn't ever go into my field of view that, like, that would be an option. So I was like, nursing, that's achievable. I can do 4 years of school. So I went straight in, did my bachelor's with nursing, graduated, and then kind of like worked for a few years and then decided, hey, I either want to do flight nursing or be a nurse practitioner. And it was 2012-ish. I don't know. There was a life flight or one of the helicopter ambulance accidents happened and everybody died. And so I got a little nervous doing the flight. And that's when nurse practitioner kind of came into my view of like, maybe I don't want to go be on a helicopter all the time. And so I put both applications in and I said, whichever one comes back first, that's what I'm going to do. And NP got acceptance on that first. And that's kind of why I went that way.
So you put in an application to be flight?
And NP. Yep.
Oh.
And I said, whichever one comes to me, I just kind of let the universe do its thing.
Well, thank God the NP came. Those helicopter crashes happen all the
lot.
time.
And it was actually the uncle of one of the nurses I was working with.
Yeah, it seems like a couple times a year there's
Yeah.
a medical helicopter that goes down.
Yeah.
Yeah, but then, I don't know, like the plane ones are so long. We do a lot of those out of the downtown airport.
Mhm.
I don't think I'd enjoy the plane because they might be on an 8-hour trip, you know.
Unless you get to fly Lindsey Vonn, that would be kind of cool.
Yeah, I guess. I don't know. Maybe. If that's your thing. Important people, treating them. It makes me nervous. Like the people who work the Chiefs games have to take the
Dude.
Chiefs players to KU. I don't want
Dude.
anything to do with that.
I do. I can't say a lot, but there was a certain somebody associated with the Chiefs, not like a big person, but they came in one time. They burnt their hand on a cast iron pan when they were like in the Super Bowl. I don't know if we tried. But he grabbed the cast iron pan out of the oven, burnt the shit out of his hand. And I was like, oh, do you need a work note? Like innocent me having no idea who this big guy is. And I'm like, he's like, we're in the playoffs and like getting ready to do Super Bowl stuff. So like, it's not going to matter. And I laughed and looked at him and I was like, and I looked at his name and I was like, oh, okay.
It's so funny how stories travel too. Like I think I think people in healthcare in the Kansas City metro knew that Andy Reid was booked into KU for chest pain before
Andy Reid did.
before Andy Reid did.
Yeah.
How long were you a nurse before you got approved to go to NP?
Let's see. I started being a nurse in June of 2011, and I started NP school about 2014.
Oh, that's pretty quick. And were you in the ER for
Yep.
3 years?
Yep.
Did you wanted to be flight, so I assume you wanted to be in emergency medicine while you were a nurse?
I did. So I actually was between two worlds of like labor and delivery or emergency room, which if you know anything about ER medicine, it's like they're anti-baby usually. They're like, get the babies away from me. But I was always like, ooh, give it to me. Those were the two things. And again, it was one of those situations where I kind of threw my applications in and I got 3 options and it was neuro ICU burn unit at MU. And I don't love neuro, and L&D and the ER. And my cousin had worked in the ER before, and that's the one that came through first. So,
MU, were you living still in Marshall at the time?
So,
where you were going to have to
yeah.
relocate regardless?
Yeah, so when I was in college, my last year, I moved home to Marshall just because I didn't need to pay room and board for the last year. It was mostly clinicals anyway. And so I was just kind of letting the universe take its course and decide for me if I was going to go to Columbia or Kansas City.
Were you with your husband at that point? Or
I
was it
was
just you that
not.
was going to have to?
It was just me. I did have a boyfriend at the time, but that's a whole shit show. I honestly was kind of running from that situation. So the further, the better. But no, we actually met in the ER. Firefighter and the nurse met in the ER. Haha.
That never happens.
No. No.
What did you expect going in? Because going into ER right out of nursing, I know a lot of people do it, but that has to be, you think it's going to be something, and then it's not that at all. What did you expect?
Oh, man, what did I expect? I expected to get my hands dirty and learn shit, and I definitely did that. I grew up very timid, very shy, but I also grew up in a bar. My mom was a waitress, and she worked, there were 4 spots to it. It was like a breakfast spot, a banquet spot, a bar, and like a dance club. And so I grew up very cultured. It was a small Missouri town, and a gay man ran it, and they like had all kinds of like rave type parties. And so I just grew up around all kinds. But I was also very quiet, very shy, very unexposed due to the small town nature also. And so I wanted to get out there. I wanted excitement. I'd watched ER with Noah Wiley when I was a kid and had started watching Grey's Anatomy. I was like almost delusional of like, this was like a dream state of like, I don't know if I can do it, but I'm going to try it. So I did it.
Yeah. And we don't have to say where you worked, but
Yeah.
where you worked was crazy. And
Yeah.
a lot of people don't know that that place is that busy. I mean, hallway beds nonstop. The clusterfuck of, I want to say management, but I don't know if that's the right term, but the managing of the situation they have there, getting every single trauma from the east side of every county out there.
BFE. Yeah.
Yeah, that's a tough place to learn, but also if you can hang in there, you get so much experience.
Yeah.
I say this to people that just get their EMTs. I'm like, you should just do a year at like AMR.
Yep.
Like, yeah, it's not a career job for most people, but the experience you get is
You'll learn more in a year than you'll learn in
unparalleled.
10 years anywhere else.
Yeah, being able to run 10 calls, and that's your primary focus. And that place doesn't want to get sued, so they hold their providers accountable.
Yeah, they do. Yeah, they do. I think one of my favorite like stories about just how busy we are, because we are like the second busiest when I was there several years ago, but we were the second busiest trauma hospital, and one of the newer out of residency orthopedic surgeons came in, and at the time we had like literally 4 traumas coming in and potentially like 4 femur fractures, which are all traumas. And he was trying to take this elbow to the OR for a washout, and I was looking at him and I was like, you're not going anywhere. And he's like, what do you mean? And I was like, he's like, I'm taking this elbow to wash it out. And I was like, I got 4 femur fractures. 2 might be open. Like I would like you to lay your eyeballs on them before you try to roll off of this elbow. And he's standing there. And mind you, this is a guy, and I actually worked with him many years later in clinic with him in the orthopedic office. He's like a slacks button up kind of guy, hair's not out of place, eats the same thing for lunch every single day. Like, and he's standing there in the middle of the night, and his scrub, you know, his like OR scrubs, his hair's all a mess, and he's like scratching his head looking at me, and he's like, I thought this was a level 2 hospital. And I was like, we're like big hospital junior. Like, we run the same volume, we run really sick people, and we capture all of that like Eastern trauma, sick people transfers and stuff like that.
So he was kind of surprised
Yeah.
that you were taking in,
Yeah.
Well, it's not abnormal for that place to get a shooting, a car wreck, cardiac arrest, traumatic,
Stabbings at
STEMI,
Walmart.
CVA,
All of it.
Yeah.
Literally all of it.
nonstop. Did you charge there eventually, right? At that
Weekend nights, baby.
What were the difficulties moving from being a nurse to having to manage that situation, especially in a place where, I won't say the company name, but like they don't necessarily put your guys' priorities first, or staffing, which now is
Yeah.
everywhere.
I
but
actually
at
got
the
in trouble for
time-
that by corporate. Yeah.
Yeah, I mean, they don't. Again, everywhere is understaffed now, but back in the day, there was definitely that facility, being a private company, had some asterisks on it. Mm-hmm. Was charging everything you expected, or was that a totally different
Everything and
experience?
more. For me, it was a personal move. It wasn't out of ego or like, yeah, I want to be on top. It was because I was going to NP school, and it was a weekend option position. And what that means is I can work 2 days on the weekend and get paid for working 3. You just have to work every single weekend. You don't get any weekends off. And so that was the position that was open. I'd been kind of filling in that point. Obviously, it's a little bit more money, so it made sense to do that at the time. What I didn't expect is like, it's just the Wild Wild West at that place at night specifically. Like, you don't have the people with doors there that, you know, are all the resources. Like, you just have to figure it out. Like, it's not like, oh, well, blah, 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 let me call the manager. It's like, no, me getting on the phone with the battalion chief or the, you know, whoever's in charge of EMS, like, hey, I know we're not closed, but this is what we got going on. If you have other options, I'm going to need you to, I mean, you really just had to, like, out of safety, learn to handle things in the way that ethically makes sense, not in a way that, like, makes everybody with doors happy.
Yeah, that got really weird during the whole debacle between high volume and closed. Like, they started using that new term.
so dumb.
It was weird because even if they're on high volume, you had two types of people from my perspective. It was like, they're on high volume, they're not closed. But in my head, I'm like, I'm doing everything possible to not take them to the high volume. But other people are like, they're a hospital.
They're high volume, so I'm going to go high volume. And then
Right.
everybody's high volume. And then you don't actually know what's happening. And that's where those conversations, I feel like, came into play. Is I would be like, okay, on the ground, this is what I actually have going on. If you need to, you can. But I don't promise anything. It's going to be a minute.
Yeah, don't you wish you could just say no?
Yeah. I mean, there were definitely times where they're like, oh, we have a hand trauma. And I'm like, bro, we don't have hand and we a mess. So, like, if you can just keep on going down the highway like 5 minutes, we good.
So you were doing the weekend option and going to NP school.
Mm-hmm.
How was that?
You know, actually, that worked out perfectly. And I did night shift. And I was a little worried about that. But being able to do 2 nights and then flip back, it was fine. I mean, it was easier to do that than to have these like weird rotating schedules of never knowing what day you worked. So I also worked PRN at another hospital just in case I needed to pick up extra. And I honestly didn't need to do it that much. I feel like it gave me the opportunity to have my Monday through Friday to get my clinicals done, all my homework. I could have a routine during the week. And then on the weekend I worked. And I didn't have kids. You know, I didn't have a kid at that time. My stepdaughter was in school and we kind of did weekends with her. So it all sort of worked out the way I needed it to, as smoothly as possible, to be doing full-time job, full-time school, and part-time school. You
had NP and flight on your... You're looking at that early. Did you know how valuable those? Because that's one thing, like PA, NP. I didn't realize how valuable those positions were. I still thought they were like a step down from doctor, but they work more so like almost parallel to those positions. Were you aware of that going in, or like before you were a nurse, or?
Definitely not before I was a nurse. Honestly, before I went to nursing school, I didn't even know what a PA was. I didn't know what a PA, a physician's assistant, was until I worked in the ER and I saw one. Nurse practitioners I sort of learned about because my cousin was one. But also I didn't really know what they did until I worked with them in the ER.
Have those positions evolved more than you could imagine?
Yeah.
Because is it still pretty difficult? Have they laxed what you need now in the ER as far as like maybe they used to run 4 doctors, but now they're allowing you to have 2 NPs and 1 doctor? Have the actual, what they have on paper, has the needs changed?
I feel like it's one of those things that constantly ebbs and flows. So I feel like it's one of those things that obviously it's like financially it needs to work for the entity that is at the top, versus like safety of like, safety and unhappiness of patients. Once that safety and unhappiness risk starts going up, then they're like, let's give you more. Well, then COVID happened and boom, we went down to no volume. And so they cut our hours. They sent us an email and said, you're welcome. You have a job. We're cutting your hours. We don't care what your contract says. And so then things started creeping back up. Numbers started creeping back up. And then people started getting sicker and sicker and sicker. And it was like less volume than it had been, but sicker people. And they rode that as long as they could to say, well, you did it. You've been doing it with less for this long. You can keep doing that. And they will ride that out until something happens and that risk goes up. And then they're like, okay. All right. Well, people are waiting in the waiting room for hours and hours, or like something, somebody shouldn't have sat in the waiting room too long. Okay. Maybe we need to reevaluate.
Do you feel like it's always overcorrection?
Yeah. There's preventative is not something that's, been super common in my experience of 15 years in the ER.
And you worked as an NP during COVID.
Yeah.
Were you in that ER?
That one. Yep.
So what was your experience in COVID being so high up? Because for us peons, and I know you probably don't see it like that.
I feel more like a peon too, to be honest.
And I'm sure you do, and I don't mean that rudely.
Yeah, no,
but like for
it.
us, you guys are really making some very serious decisions, especially at like the BSI guidelines. How was that for you?
I mean, it was one of those things where it was more like, as a nurse practitioner, I'm not seeing the people that are getting tubed and stuff like that. I mean, there were occasionally like people that would deteriorate while they were there, and I'm like, hey doc, like because we don't intubate as NPs. So that's why I say I feel like a peon too, because like medics can intubate and I can't, right? So it's like I feel like you're still a little bit above me in skill level, right? You still have stuff that you do that I don't. And I also feel like I lost some skills going to a nurse practitioner as a nurse in critical care because I don't do as much of it. That's a whole other thing. But I do feel like there was a very big amount of the doctors were like, well, I'm taking care of all these sick people. I need you to take care of these people. And these people were sick babies. And I was like, okay, well, I have to be the one to make a decision. Is this baby well enough to go home? And we're hearing things like, oh, well, Children's Mercy is sending kids home when their SAT's 88%. And I'm like, this is giving me pucker factor. And like, I don't want to be the one making that decision. And I would be a pain in the ass sometimes and be like, hey, doc, I think this kid's fine. Their workup's fine. We did X, Y, and Z. Can you just come lay eyeballs on them before I discharge them? Like, I was a pain in the ass about it because I don't want to be the person that goes home at the end of the day that made the wrong decision. So I do feel like that increased a little bit than it had prior, the responsibility on that side of things.
Well, with someone with your qualifications, like, what did you think about COVID when it was happening versus now, armchair quarterbacking after it's all over?
Oh, man, let's get into it. Let's also add in, I was super pregnant through COVID.
Oh, no.
Oh, yeah, that was fun when, I don't know, Europe or UK or something like that shut down. They were like, everybody that's pregnant doesn't leave your house. And I'm like, I'm working in the ER. And my brother, he works for like BMW corporate, and he was like panicking. He's like, quit your job right now. I will pay all your bills. I don't know how, but I'll do it. So I think but I also was of the mindset of like, there are sick people that are really sick, and there's just all this bullshit. Like, I need a work note. I can't go back to work. And all the policies were so gray. It was like people would call the health department and they would tell them to come to the ER to get a test to prove that they didn't have COVID. And I'm like, these tests are not 100%. This is absolutely an abuse of the emergency department. No, I'm not writing you a note that says you can go back to work with all this uncertainty. Like, I'm not going to be the one. They're going to be like, she said I could go back to work, and then 2 days later you test positive, you infiltrated, I didn't want that responsibility, and I just would tell people to go on. Like, you're not sick enough to be in the ER. Go talk to your primary care doctor or the health department. They can write you that note. My OBGYN and I actually would early on, let's see, I had her at the end of July. So, doing all the appointments and stuff, we'd come into the office. We'd both have our masks on. He'd bring his coffee cup in. He's an old farmer. Love that guy. And he'd sit down in the chair. We'd both take our mask off. He'd sit there and drinking his coffee, and we would just talk about it. It was very like, I think there was this like lack of human connection during that time, even between professionals. Like when I went in my postpartum visit, I had my baby with me because my husband's a fireman. He was working a 24-hour shift. Excuse me. And they were like, oh, well, you can't have this appointment because you have your baby with you. And I was like, what do you want me to do with her? Leave her in the car? She's 6 weeks old. Like, I was like, the other option is I take her downstairs to one of my friends in the ER where all these sick ass people are, and they can hold on to her for me so she can get sick. Or you can let her sleep in her car seat while we have this 5-minute appointment. Like, and I was like, please go ask Dr. So-and-so. And they did. And he was like, she's fine. Like, let her come back. I think things like that just got so blown out of proportion. Looking back now, it's like, we just had priorities in weird places, I think. I don't know. I'm curious what your thoughts were, like, from, like, looking at the ER from your side of things.
Well, so COVID was awesome for a little bit.
For like a week for us, but yeah.
Yeah, I think it was different for the hospitals because people would just drive there and then ask you to test them. But so for like the first month and a half of COVID, if you were working on the ambulance, it was the greatest job ever because nobody would call. It was like you almost found out that you don't really need ambulances because we went from running 10 calls in 12 hours to running maybe one call. And then that one call would play out like this. You'd show up and you'd be like, what's going on? And they'd be like, oh my God, my brother's cousin lives in Florida. And he knows a lady who just traveled to Vegas, and she knows a guy who's her cousin's friend who actually tested positive for COVID. And I'm like,
am I going to die?
I'm like, so, and then you saw that person. They're like, oh no, they live 7 states away. And I'm like, oh, you're going to be fine. And they would just go, oh.
I don't need you.
So it was almost like, or so you could reassure them so much that part was almost hilarious. But I also didn't know because I got assigned a real N95, the one that has like the plastic cage, and they told us to put it in a Tupperware box and drill holes in it.
Oh, I have a story coming up after this.
So I was like that we had to keep these masks, and that was the only mask we have. But unfortunately, I was kind of like cavalier about it. You know, I was like, well, I mean, whatever. I was reading some of the data at the time, and I'm like, I don't have 4 or more comorbidities. But then as it unfolded, I became pretty upset that people refused to read anything but the mainstream narrative. Like nothing. They wouldn't read anything. They wouldn't believe in vitamins. They didn't believe in anything. Then you had people wearing paper masks,
and trash
the
bags.
same one. Yeah, and their paper mask would be black and brown with like, you know, their makeup or whatever debris or dirt that's got on it. And I just feel like here's one thing though too I'll add. I recently had an experience talking to somebody who went to New York. And they had a totally different experience where they really were seeing people dying all day long. They said they were putting like 6 people in a bed and like duct taping them and then putting them in the freezer together because they were running out of space. So in one hand, that kind of changed my opinion too, because I really got in this mode where I was like, okay, it was the obese people, the people with comorbidities, diabetes, those higher end things. It was those people. And then I hear that story and I'm like, you know what? Maybe it was more devastating and we just got exposed to it kind of in a weird.
Yeah. And I had a friend actually who was a respiratory therapist that was traveling between, I think, Texas. I don't think she went to New York. She was in like Texas, Alabama. And she definitely was like, she was managing those vents, like, and she just had like multiple people dying every single day. So I feel like I did take that into account of like, it is serious, and it was like people with comorbidities. It wasn't young people. It wasn't healthy people. It was people that had all these other things. And I think things just got so divided. The mask story, and then you started talking about makeup. So the hospital I was working at, there was one point where we had our just plain level 1 mask, and we were told we had to put it in a community box of cardboard at the end of our shift, and that they were getting cleaned with a black light. And then the next day you're handed a random mask and you had to wear it.
No fucking way.
Smeared with other people's makeup and slobber and whatever else was on it. So my husband was like, who's also paramedic, was like, here's my respirator, like his paint respirator. He was like, take this. That's fucking gross. And they were like, you have to. And then they told me, they were like, well, you can't wear this respirator to work. It's scaring people. And I said, it scares me to put someone's nasty makeup covered mask on my face. I can't keep my own. This is disgusting. So I'm not taking it off. I was like, you can send me home, or you can let me wear this, or let me keep my own damn mask. And eventually that kind of shifted. And then it was like, I think another funny part about this mask thing was like, you can't wear an N95 mask if you haven't been tested by the hospital, but you have to wear an N95 mask to not get COVID. Yet no one was testing us to update our, you know, the stupid, like they squirt the puff in your mask.
Test.
Yeah, the fit test. And I was like, so you want us to die of COVID because we're not getting tested, even though everybody and their dog, except maybe one person in the entire hospital, requires a different shaped mask. It was the silly, like, and that's where I say, I feel like things just got so out of hand. It was like, we're not using any common sense here. Like, this doesn't make any damn sense.
Yeah. And they also, the standards were so much different for different agencies. Like the paint mask you mentioned, going into KU Medical, which is right across the state line here, they all had the paint masks with like the filters you could take out of the side, the Bane looking masks.
Yeah.
And
I definitely felt very Darth Vader.
Yeah, I'm like, they're giving us disposable surgicals. We're out of N95s, and we're taking the patient to you that you're recepting with 5 people wearing paint masks.
Yeah.
What the fuck are we doing?
Nobody knew.
Yeah.
I mean, St. Luke's was apparently or other hospital was apparently taking windows out and like creating negative pressure rooms. And it was like, I don't know. I think, you know, when we look back, and I think the biggest mistake we made was failing to treat each other like humans and allowing that like political and opinion divide to form in between everybody.
So and I don't want to get you in trouble, but what about like now looking back and seeing how corrupt the HHS was, you know, in the government as far as, I mean, I know you just said that you don't see it like this, but you really are. You are basically a doctor. And in 5 years, when nobody goes to med school and only people will be willing to accept the cost of NP and PA, you're only going to become that more valuable. So you have to basically, whether you want to or not, start developing opinions and make these decisions. And you have to be careful what you say because of your employment and things like that. Not acutely, but down the road.
Yeah.
But like to find out, you know, the monetary benefits that a guy like Fauci is receiving, and they're pushing this through, to see the reactions from the vaccine, and nobody will even let you say those two words in a sentence without telling you that you're a piece of shit.
Oh yeah. I was, so personally, I like in the whole, like you didn't get any, as a healthcare provider, you didn't get any autonomy to have an opinion. There was no room to have an opinion.
Right.
It was get the vaccine or be fired. And at the time I wasn't anti-vax by any stretch of the imagination. You know, I have a lot more questions now than I did then. But at the time I was breastfeeding, and that was the hardest thing for me, was to say, do I do this? Like, because it doesn't just affect me as a human, it affects my kid. And we do have long-term data, but we don't in this particular use. And there were a lot of nurses that just quit their jobs because of it. And I think if I had the opinion that I had now, that I had then, I don't know that I would have stayed. I don't know. And I think a lot of this is what triggered me into going into the coaching realm, to be able to utilize my medical knowledge and seeing the just do this because into the, okay, well, let's use some nuance for you as a human. What is good for you? And part of that stems back in nursing school. There was a textbook that talked about, you know, as a nurse, you're not diagnosing. As a nurse practitioner, you do. But it talked about like 80% of the time, 80 to 90% of the time, your patient is going to tell you what's wrong with them if you listen to them. And I think we don't use that enough in medicine now. We allow these like policies and things that are influenced by financial repercussions and people getting paid for things more than we would like to think. And I think I think as medical people, I think most of us go into medicine, whether it's a doctor, a nurse practitioner, or PA, we go into medicine to help people. And we follow the guidelines because we truly believe, and that's what the literature and the evidence-based guideline is, the peer-reviewed evidence tells us is best for the patient. But I think there's a lot more nuance. I think a lot of this literature is old that we're comparing it to. And I think I think things are changing. I think things are shifting. I think people are waking up to well, maybe just because a textbook says this is what's best for me, it's not. What's best for me. And I'm not like, let's not do anything, because I do think there's some benefit to like herd immunity for certain things. You know, you look at like, oh, well, this kid's on chemotherapy and they can't get the measles vaccine. Our job is like herd immunity, protect them. But like, I'm not opposed to, can we redo the evidence? Can we do some new literature, some new reviews? Can we do some new studies to see where things actually lie, to see the safety profiles? Why can't we do that? Why are we still basing this on old evidence and old information? And old could be 2 years. Like, it doesn't have to be 20 years old, but some of it is that we're practicing on. I think when people in positions that get paid large amounts of money say no to new research, I think that's concerning.
Did you develop a skepticism, like a healthy skepticism from that experience?
Definitely. I ask more questions now than I did before. And it was just an ignorance of like a blissful ignorance of, I want to help people. I'm just going to do what the books say.
So you've kind of ultimately put yourself in this position now where you're operating in this weird world, which is a great segue, which you're going into coaching and giving people advice. For starters, where do you draw the line at what you can legally tell people? Even though you know the information and it may or may not hurt them, but it probably will not, you know, telling them to take this vitamin, whatever, or get in the sauna 4 times a week. And then maybe you cite the study from, you know, Sweden or whatever. And where are you legally allowed to advise now for the coaching role?
So as a coach, I am not using my license. I am not diagnosing. I am not prescribing. I am giving recommendations. So just like you would go see a dietitian, and dietitians can recommend you consider taking a multivitamin, but run everything by your primary care doctor to make sure they're okay with it, right? I'm not saying here's a prescription for this. I'm saying if I had a client in this position, I would recommend X, Y, and Z. This is what I'm recommending. Run that by your provider. But honestly, I find that like less often do I even need to do, like, it doesn't run into that. Most of the time it's like, well, what do you think you need? Like, what do you think you need? What do you think's going on? Like, and then allowing the person to have some autonomy, because again, most of the time the person knows what they need. They just need some reassurance that they're not doing something totally whack. And that's what I can do is like, the evidence and literature is like not super supportive of that. Maybe we pivot. And honestly, at the end of the day, health and wellness like comes down to honestly like a shit ton of nervous system regulation. People get their nervous system under control and they stop needing a lot of this modern medicine bullshit.
Right. So did you have an epiphany where you realized that, because a lot of people, they constantly blame genetics, and yeah, you can't beat genetics sometimes, but also that allows them to basically deny exercise, supplementation, diet, nutrition. It allows them to completely deny that and say, well, it doesn't matter if I do everything right. My dad has hypertension.
Yeah, that drives me nuts.
And then they also are like, well, you're just paying for really expensive urine.
Yeah.
You know? So was your opinion similar to that, or have you always kind of had like a healthy side where you were diving into like holistic medicine?
I feel like I have always geared towards a more holistic side of nursing. Genetics is the bullet. Environment and choices is the trigger. And so, yeah, your genetics may make you more prone to having those things. Absolutely. I mean, we look at like the Polynesian community, like their rates for like diabetes, high blood pressure, high cholesterol, like their genetic predisposition is higher than probably any other population. I'm not basing that on anything, but just from what I see, is definitely, but it just means that person has to work that much harder to not pull the trigger. So supplementation is like, I tell people, you know, if you feel called to a supplement and you want to add things in, cool. Do we guarantee that's going to like be a magic pill? Absolutely not. Like, it comes down more to like your lifestyle and your nutrition and movement and nervous system regulation, to get that cortisol down so that you're not functioning in a fight or flight for those things to work. It's kind of like slapping a Band-Aid on a bullet hole if you're not doing anything else.
Have you looked at like methylation disorders?
I need to look into that more, but I do think there is something there. And it's funny you bring that up. The methylation, like methylated B12 and all of that, really falls under the like hypermobility spectrum. I have hypermobility. I have Ehlers-Danlos syndrome. And I consult with a lot of people that also have those things because it's a condition that it just gets blown off. Oftentimes it's these people that have like somebody that has an allergy list that's like 4 pages long. You're like, what the fuck am I going to give you? Or they have, you know, a ton of GI, like cyclic vomiting. And you're like, why are you here every week in the ER for vomiting? Or they have like dizzy spells or passing out, things like postural orthostatic tachycardia syndrome or POTS syndrome. Fibromyalgia honestly probably falls under that same thing where it's like you have all these vague pain complaints. Well, it's probably polyfiber neuropathy that's because of your connective tissue disorder that nobody knows about because there's not a lot of literature about it. And people, honestly, it's a lot of women and the doctors look at them and say, you're anxious, here's an SSRI, go on your way. And I think that has pulled me into that. But that methylation, it kind of falls in this bucket of weirdness of like, people think it's woo science, woo crack science, but it's not. It's like hypermobility itself, and methylation falls into this. Is like, it's not rare. It's just underdiagnosed.
Well, if you want to take a methylation test and find, they say that 50% of the Western population has a methylation disorder, and they say, like, I can cite the study, but you can look it up. Yeah. It's out there. That's what they estimate. But you know, if that's true, then I always tell people, like, the first thing that I learned is immediately check your supplements to see what form of, if it has cyanocobalamin, you know that's probably not a good product company because they're using the cheapest form of B12 possible.
Yeah.
You rarely see hydrocobalamin, but like if they put in methylcobalamin in there, you know that at least they're in the right mindset. So I always tell people to like check for that first.
Yeah, high quality supplements is a must. USP designation is another one, is like making sure that, because supplements aren't FDA regulated, and I have my thoughts on the FDA too, but I do think having some sort of checks and balances, because you could have Joe Blow sending you a capsule that's full of like baking soda and charging you $40 for it. So I do think there's like benefit to saying, okay, USP evaluated this, and I think it's USP. They evaluated this, and what they say is in it is actually in it. So I think like verifying your supplements, and to that degree, like making sure you've got the right kind of supplement in it is so important.
What do you think about like N-acetylcysteine and glutathione?
I mean, I think you're way above my head. I haven't dug much into these things. I think there is benefit to things like peptides and these different supplements. I think we need more studies on it. And I think that's because I do see people that are taking these things and benefiting from these things. And there are small like case studies on this. Why isn't the FDA or whoever, puts on these big studies? Why aren't they studying it? Well, then these medications that cost $10,000 a month might not be as necessary. So you do kind of have to taste that risk of like, well, there's not a lot of testing on it, but risk versus benefit, man. Do I want to get so unhealthy I need a pharma medication that's going to pay some CEO a whole bunch of money? Or do I want to try something that lots of people are taking and have had good results with and minimal like bad outcomes reported? Again, that comes down to like autonomy of making decisions on your own health and what you feel is going to benefit you. That was kind of a circular answer.
Before we get off the supplements, where do you get that type of information from right now?
Right now, I mean, I do my best to use UpToDate, which UpToDate is like the most up-to-date information in the medical world. It's all peer-reviewed. Some of this stuff has...
Is that a website, UpToDate?
It's a website. Yeah, you have to have a subscription. I believe I have it through the hospital. Excuse me. And then there's things like, I'm blanking. Shaking the table.
PubMed.
Also. Yeah, PubMed. PubMed is a good one. It's peer-reviewed. It's evidence-based. And most of it, you can get your information. You can get articles. So PubMed is a great resource if you're wanting to dig into that kind of information. That is sort of the rabbit hole I'm going into now. My thing right now has really been like more nervous system regulation and things like that. So I haven't dug as much into that, but it's certainly it's something that if somebody comes to me and says, hey, what about this? I'm going to pull it up on UpToDate, PubMed, look into it. I'm going to look for the bad ones, right? Like I'm going to look for like, what is the worst case scenario taking this? That's where I'm going to start when I'm doing research on something, so that I know, okay, well, there's been one case of this. Is that really an issue? Or, hey, they're seeing a pattern of this. Like maybe that's a no-go for me. Again, just because there's not a lot of support behind those things. They're smaller studies, but there's a lot of people using them too. So also reaching out to people that are prescribing those things, people that are using those things and asking their experience. I wouldn't ever recommend somebody just see an article on the internet about something and then go start using it. Like I think that's a terrible idea too.
So what are the core principles and what type of person do you think that you'll be successful treating in your coaching element?
I don't love the word treating, honestly. I like...
Redact that.
I mean...
The S&P's over 50,000. Yeah, okay.
I don't know what word I would replace that with.
Assisting... help
co-creating health with.
Help curating a plan to be better.
Yeah.
Well, first off, what type of client is ideal for you to take on, and then we'll go into like what principles do you work off of right now to improve them?
Man.
What's the ideal client? Is that an easier way?
The ideal client is somebody who is getting blown off by the medical system. They're not finding answers. They feel like shit all the time. They're tired. They're burnout. They're stressed, and they just can't function beyond day to day. They can't see beyond today.
So what are like the common acute symptoms that people come to you for?
Mostly it's I'm tired, I'm stressed, I'm snapping at my loved ones, I'm grumpy at work, I'm yelling at my kids, I'm on my phone too much. I would also say the subset of like hypermobility, and they're kind of two different things, but I found out I had hypermobility after I had my daughter, and then I looked back at my life and my whole family, and I'm like, oh, all of this shit makes sense now. And that is something that, like, when patients come into the ER now, I can look at them and I'm like, how many times have you dislocated your knee? How many pillows do you sleep with? Do you get dizzy when you stand up? You know, X, Y, and Z. And they're like, do you live in my house? How do you know all these things? And I'm like, you probably have hypermobility. You should go get checked, like, blah, blah, blah. But I feel like that is a subset of people that I do more consulting with, like health consulting versus just like coaching. My coaching side is more like somatics and breathwork and meditation and just making goals and moving forward. Whereas my consulting side is more like the health side of like, okay, how do we develop a plan for you to get you feeling better on the more medical side? So supplements and game plans, and do you need to see a specialist? Do you not? That hypermobility definitely falls under that as well as a subclient.
And so if they come to you with like chronic lethargy and overuse of their electronic devices, what's like the initial regimen, or do you have like a structured intake that you do with them?
Yeah, no, yes and no. It's energy expenditure. 100% is we sit down and we make a list of like, okay, let's make 3 lists. What are you spending most of your energy on? What do you want to spend your energy on? And what's keeping you from that? And then honestly, gratitude and grounding are the 2 biggest staples of my practice. What I work with clients on, because when you can get back to getting your damn feet in the grass, taking a second to stop first thing in the morning, not picking up your phone, not doing this, like, the earth truly is neutralizing, right? And so we are positive beings spinning around in a meat suit on this planet, and then we're on devices that make everything just more electric, less grounded, more flighty, more stuck in like, you know, stuck in dorsal vagal and not being present. And so doing body checks is the first activity I do with almost all of my clients. And it's literally just set an alarm on your phone. Ironic that we're using our phones, but that's where we're at. Every 2 hours, set a very gentle alarm, not like the one. And every 2 hours, I don't care if you're in the bathroom. I don't care if you're sitting at your desk working. I don't care if you're running a call. Like, you don't have to stop what you're doing if you're like intubating someone, but being present with where you're at, breathing into your abdomen, that decreases that like fight or flight, and it puts you back more into like a rest and digest state so that you can be present. Just being aware of your nervous system every 2 hours. When I first started doing this, working in the ER, didn't matter what I was doing. I would stop what I was doing, take a breath. If I could step away, go to the bathroom, take 2 or 3 breaths, just resetting. I felt like I was leaving work plugged into a light socket most of the time, every single day. I mean, 12 hours, beeping, honking, damn ambulance radio going off. I work at a different hospital now. It's more rural, and they have that ambulance radio off, and we hear every call. We hear Live Loud Eagle. We hear Kansas City sometime. I'm like, what are we doing? So it's just constant overstimulation. And when I do these body checks, I can have the same busy type of day. And when I leave, I feel like I can take a breath. I don't feel stress. I just feel like a different human being. So resetting and just being able to allow yourself to be present instead of stressing out about all the shit that doesn't change anything, that's the starting place. Gratitude, being grateful for, you know, just your body and the fact that you're here. And that kind of dives more into other things. But literally, when you start identifying, okay, I'm grateful for I have air to breathe. I'm grateful I have food to eat. I'm grateful I have a house. And all of this sounds really like tiny and small. But when you start thinking of gratitude and things you are excited for, more of that comes to you. When you keep thinking about like, oh, I hate my job and I hate my spouse and I hate my dog and I hate my carpet and I hate my hair and I'm fat and I'm this and I'm that, you're attracting all of that negative shit. And so it's almost like fake it till you become it. Fake it. And you're not faking it, but you're like, do I feel happy and positive that I have a house and food to eat? No, I don't give a fuck. I'm pissed at my boss. Like, when you force yourself to shift, and part of that comes into the body checks and allowing your body to exist in a regulated state, you can more easily do that.
Okay, before we segue again, but on the CNS, like calming that, how do you deal with somebody that comes to you and they're prescribed an amphetamine then?
It's fine. I think there's still... Oops.
It's totally fine.
Sorry. I think I'm not against medication. That's another thing is like, I think there is a time and a place, and if it's working well for you, cool. Can you do nervous system regulation on prescribed amphetamines like Adderall or whatever for ADHD? Absolutely. Because your brain is not a separate being. Your brain and your metaphorical being they're together. And so you can still regulate yourself, and it actually allows that medication to be more efficient versus just making your whole body. It's like when you have a path that your intention is set on. I mean, personally, I have ADHD. I have been medicated for it before. And now that I have focused on nervous system regulation and being more intentional with what I'm doing and being more present, I don't need it. Like, and that's not everyone's story, but I've seen it happen not just with me, but with other clients that I've had. Also, have I seen people that continue amphetamines but still have a more clear path and are more functional? Because I also have seen people on amphetamines and Adderall that they're still squirrels. Like, either it makes it worse or it's just still not fixing the problem. So again, it's less finding balance. It's more, how do you find a flow? Flowing down the river, you're going to keep going. Like, it's like a ping pong ball. You're going to keep going. But how do you get grounded in your body so that you're going in the direction that you want to be going instead of flying off the edge?
Okay, then what about having kids and not wanting them to be iPad babies? What kind of stake do you put in that? I guess, so like the Adderall thing, I personally think is huge because I feel like even if you have ADHD, for one, like we can talk about the long-term, you know, negativity or negative effects of being on Adderall. And then like for one, you get in trouble when you tell somebody like how scary it is that you're taking an amphetamine every day and they just are like, oh, it's got ADHD. But I would think with your line of work, focusing on calming the nervous system, it would be a huge task if they were prescribed an amphetamine. So that's why I asked you about that. But like having an iPad baby, how do you feel about that, and how in your household do you start to diffuse that problem?
iPad babies are, it fries their dopamine. It's basically baby heroin. I'm not opposed to iPads. I'm not opposed to screens. My husband and my kid were playing Xbox Lego City earlier today. I think it's about, again, and I feel like I'm not answering any of your questions, but it comes down to what works for you and what works for your family. There are people who let their kids play on screens for 8 and 10 hours a day, and then they're questioning why their kid is having outbursts and kicking things and screaming and this and that. And it's like, this is very clear they have no regulation because of this, because they tap, they click, they play, that is what their brain is craving. I think you have to find a balance, and I think you have to have boundaries. It's hard to tell your kid no. Just the other day, it's funny you bring this up. We were driving home from Columbia, went to my best friend's house, we had a sleepover, and I brought her iPad. 2 hours is a long car ride, right? I'm not opposed to letting you have it some. We get in the car and she's like, Mommy, can I have my iPad? And I'm like, no. And I was like, how about you draw for a few minutes? Like, you can draw some pictures. She's got markers. And I think having options is really important. And not just having an iPad. Have a little travel magnet set they can play with. They're probably going to drop it on the floor and they're going to scream about it, and it's fine. You're just going to say, look, I'm driving, I can't pick it up right now. Or they're going to drop their markers. Fix the problem, right? Like, get a cup holder they can put their markers in, and then if they drop them, then they're just going to have to be bored. And guess what? It's okay for kids to be bored. That's where creativity comes from. But also, for 2 hours, do I think it's okay for her to watch a show or a movie? Sure. So anyway, she was like, Mommy, can I have my iPad? And I said, no. I said, let's do about 15 minutes of just drawing for a little bit, and then I'll let you have it. So we get home, and the next day I get home from a shift, and on the table there's this picture. She's 5, by the way. There's this picture, and it's drawn in black marker. And there's a picture of me with my seatbelt on, smiling, and there's a picture of her right behind me with a sad face and her arms crossed with a sad face and tears. And it says, in her best spelling, my mom is the worst.
Oh.
When I tell you my heart broke and I shed a tear, and I am not someone who cries. The tear didn't come out, so it doesn't count. But I had no context for where this came from. And I just came home from a long 12-hour shift that was unpleasant. And that was the first thing I saw. And I felt like the shittiest mom ever. I was like, because saying no comes with some discomfort. But you have to figure out how to be comfortable with discomfort. You don't, like, would I love to eat nerd gummies and mashed potatoes and macaroni and cheese and spaghetti and blocks of cream cheese for my whole life? I would absolutely love that. But, like, I know that's not going to keep me alive for very long. And so I have to tell myself no. And so is the easier option to tell your kid, sure, you can have the iPad, you can play your Xbox for 8 hours today because I don't want to deal with you because my nervous system is not regulated and this is easier for me? You have to be able to be you have to be able to be comfortable with the discomfort, and you have to just draw that boundary of, like, knowing your why. And that comes into coaching a lot, is like people make goals and then they don't succeed at them. And the reason they don't succeed at them is because they don't know their why. They don't know why they're doing it. They're doing it because they saw it on social media. They're doing 75 hard because their friend is doing it. They're not doing it for a reason that they're doing it. If you look at iPads, like, you know, I want them to be able to use this as a resource or a tool or, like, you know, sometimes some entertainment. Sure. If you look at it to regulate your own nervous system to shut your kid up, that's where you're going to run into problems.
Yeah. Well, and I'm sure I want to say, like, I have a heart, especially for working parents, that's just their easy way to get a breath. You know, they're like, oh, put the kid on the iPad.
I do it too sometimes. There's no judgment.
Sure. No,
Boundaries.
Absolutely. There's no judgment. But it's also, if you're smart enough to know, which most people are, the damage that's causing. I mean, I guess, how old are you?
I'm 37.
Okay. So you definitely remember dial-up, where you had to load a YouTube video before you went to school, and then you might be able to watch half of the 4-minute video when you get home. Yeah, unless your mom's on the phone.
And I fried the computer with LimeWire. Sorry, Mom. I lied.
Bear share.
I don't like to lie, but I did. Bear share, yeah. I was a LimeWire girl. It was my brother's fault. He told me how to do it, so I'm going to blame it on him. But
okay,
yes.
Well. Yeah, but I bet you got some kick-ass music for free.
Oh, yeah. I got some baller CDs somewhere in a box.
Yeah, it's just so strange. Even, like I remember, this is going to be so awkward, but I remember, like...
I love awkward.
Okay, well, perfect. I remember, like, even having to look up porn on my PSP, and it would take so long. So I just can't imagine having a kid that can just pull it up on a website now. Do they have things, like, I know YouTube has YouTube Kids. Do they have the ability to lock iPads out for things like that?
Yeah,
like on the internet browser?
You can. I think, number one, and I've not ever let my kid have YouTube Kids, but I've heard several therapists digesting this and basically saying, like, they can tell a YouTube Kids kid when they walk in the room, because it's kind of like there's just these short videos and then it's just so much dopamine. I mean, it's like TikTok for adults. I mean, adults get on TikTok and scroll. It fries their brains. It also allows, like, sure, it's safe, but, like, you look at, like, I don't know, you hear all these stories about, like, the Amazon kids, you know, asking. I saw an article the other day where Amazon kid asked a kid, like a 6-year-old, what she was wearing. And it was like, where the hell did that come from? Like, maybe it was a glitch. Was it somebody hacking into the system? Maybe. We don't know. I don't think technology is safe, and I think you have to have very strict boundaries. I get, like, an email update on what my kid's watching on Netflix, and I go through her iPad and I look on it. We just don't do certain things. Like, our iPad time is, like, we have a drawing app where she can draw on it. She has PBS Kids, and she listens to music. And that's kind of it. We just keep it minimal. Sure, are there other things they can do and games they can play? Sure. Her Xbox, like, she has Minecraft. We don't put it online. It won't ever go online. None of that. Like, this is for us to enjoy at home. Just having strict boundaries, and honestly just blissful ignorance of, like, you don't need to tell kids about that. At school someday they're going to hear about it from their friends, but that's just not what we do.
Yeah, it's kind of the natural development is that they learn it from other kids who have learned it somewhere.
I'm struggling with public school right now.
I was going to ask you literally about school. I guess if your child's 5, she
Mm-hmm.
she missed the online learning bubble, which she probably would have been too young for anyway. But
yeah.
I mean, that's a huge thing that really ruined kids and their developmental learning and all of that, because once they went digital, it seems like they sold out. Like, I've got kids that go to independent school, which isn't necessarily like a super rich district, but even they are like assigned an iPad or a laptop. And
My
I'm
kindergartner is taking tests on computers already.
like, it's crazy. I mean,
I
they're
hate
like
it.
13 and they're bringing home a school computer. And I'm
Yeah.
like, what in the fuck?
Yeah.
What about sleep? What have you dove into there? Especially because you worked night shift for so long. Like, knowing how bad, and I don't know, but especially for males with like the tanking of testosterone, that's really big. What about for females and just in general?
I think females in general are plagued with chronic fatigue, whether you're working nights or not. I mean, I'm sure men too, but men have a little bit more of an ego, and they're like, "Oh, I'm gonna tough through it, because I'm raw. I am man.
I worked
Hear
the
me
night
roar."
shift.
Yeah, I'm gonna stay up all day. That was another thing about COVID. Was like, I don't know how we survived that shit. My husband worked 24 hours. He was at 18s at the time on the ambulance, and he would work 24 hours on the ambulance, running 20 calls in a 24-hour shift. And then I would work night shift, and then I would come home, hand him the baby after he'd been up all night, and then I would try to I honestly, I think I blacked out for 2 years. Anyway, sleep. Yeah, I mean, sleep has been, by nature, I'm a night owl. I do see there being some environmental genetic factors in there. My mom has always been a night owl. Everyone in my mom's side of the family has been a night owl. My dad's a farmer. He used to wake up at 4 a.m. without an alarm clock. I'm like, I don't understand how you do that. I worked night shift while I was pregnant, and then I was working night shift after I had her. Again, my husband was working 24-hour shifts, and so inherently we were desperate for sleep in the mornings. And this kid, I think because she was in utero when I was working night shift, I mean, she would stay up till 11, midnight when she was tiny, and she would sleep till 10 a.m. And that just has not changed. And to our benefit and to our detriment as well, because now that she's in public school, it's like you have to get up early and get ready and be functional and then go to bed early. That girl won't go to sleep before 9:30. And then she doesn't get enough sleep, and then we got to wake her up. It doesn't matter how much sleep scheduling we did. It just, I think the pattern was set, honestly, and I'm sure you can change it, but our schedules don't allow for that. I found myself getting mad at my kid for like, why won't you go to sleep early? And I'm like, our schedule doesn't allow for it. Our life does not accommodate that. And I think accepting that with where you're at with your job and your life and your family is like, instead of trying to force yourself into a box that's accepted, the 9 to 5, eat dinner at 6 and go to bed at 9:30 and get up at 5 a.m., that doesn't work for everybody, especially in our life. And then making a set plan of like, okay, well, what does it's like a titration. It's like an insulin drip titration instead of just an algorithm. It's more like, okay, what works today and how can we make this work? And for us, it's been very like, if I'm working up late, Colby doesn't work the day before, he'll get up, he'll get her to school, he'll let me sleep in, I'll get up, a little bit later, like 10 o'clock, and then I can function. Whereas, sure, I can force myself to get up after 3 hours of sleep, but then I am insane to deal with when I'm sleep deprived. But it affects your whole life. And I think you also have to evaluate, because if I was a single mom, I couldn't do that. I would be constantly living in a state of just exhaustion. I still am exhausted. But I have flexibility with my husband. You have to have a teamwork for that. And if it doesn't, then you have to look at your life and say, this is not fucking working. What do I need to change to make this work so that I am not miserable? Who wants to live a life where you're just fucking tired all the time?
Yeah, you said something really important too there, though. It's like we can't always make it work, or you said it much more better. You said it way more savvy than I did. But like, I do get exhausted with and we'll talk like about the microwave stuff here and the plastics, but like, you can't do it all. And if you start thinking like, I didn't do everything right today, it can really exhaust you. Like, no, maybe I'm not going to get 8 hours of sleep from 9 to 5 today. But you know what? I also ate healthy today, and I took my vitamins, and I got a little bit, even though I got 20 minutes on the treadmill today. Like, I feel like I'm definitely one of those people, and it's probably the OCD, where I get pretty worked up if I can't do it all right. But yeah, I think it's big to remind people that if just do as best as you can, because that's all you really can do. Did you really get rid of your microwave?
I really don't have a microwave.
That's so great.
We haven't had a microwave since my husband tore our kitchen out right before COVID. Oh, that was so fun. Waiting in line for 4 hours to get a block of wood. When I say ripped out, I mean no ceiling, no walls, no floor, no plumbing. We had a crock pot in the bathroom. My breastfeeding station was with the crock pot in the bathroom sink in a camping chair. And we made this decision we had talked about it, of like, one, it just zaps any nutrients out of your food. Plus, it just makes stuff soggy and weird. Like, it gets all rubbery on the outside and like mushy on the inside. It doesn't matter what you're trying to warm up. Then if you throw something plastic in the microwave, you're just microwaving these microplastics. UK studies have showed that like when they're pulling blood clots out of people's lungs or legs or whatever, there were some that were like way over 50% plastic, microplastics. And so it's out there. I don't know the study right off my hand, but every time you're essentially melting plastic into your food and then you're eating it, it's kind of like we're pre-embalming ourselves. There's chemicals, it messes with hormones. It's like, why? There's so many. So we moved to an air fryer. We were also like, our house is not huge. We have a 1,200 square foot house. Really usable space is like 900 square foot. And so we just were like, okay, the kitchen is where we want to spend most of our time. Do we want to eat our space, or do we just want to pivot? Most of the time when we're home with her, she was in preschool, or like not even in preschool yet. It's like, we can just use the stove or the oven or whatever. We did get an air fryer because it's a little bit quicker. Honestly, Teflon's starting to chip on it and we're getting ready to chuck it. But for the most part, I put stuff in a dish inside of it. Oh God, sorry. For the most part, I put things in a dish and use it in there, which still it's off-gassing things, I'm sure. But honestly, I've just started taking a big pot, and I have like an Instapot grate. I don't know if you have an Instapot, the silver thing, the tray you put in the bottom. And I just put that in the bottom of the pan, and I put a couple inches of water in the bottom of it, put the top on it. 5-8 minutes, you've got a heated up dish. Like, if you heat up rice in that, it's moist and soft. It's not like chewing on a piece, like a rock, if you put it in the microwave. So like, the effect of warming something up that way is so much better. It tastes better. It's got a better texture. The oven obviously takes a long time. Like, I laughed at myself the other day. I baked chicken in the oven and I was like, when's the last time I did this? I have no idea. Like, this is insane. I don't know if you've ever been at a station with my husband, but he's an insane cook, and I gave up approximately 5 minutes into us living together cooking because he's amazing. He cooks great, and I'm that person that, like, my ADHD and cooking, like, I will blow the whole kitchen up. Like, there will be 85 forks on the cabinet. Like, not a single pot or pan will be washed. Like, I definitely burn something, and it's usually me and some of the food. I undercook. One time, one of the first times I used the air fryer, I got those big chicken planks from Costco, and Colby was like, will you heat some of those up for me? And I was like, yeah, he's asking me to do something. Okay, cool. That bitch looked golden on the outside. He ate about half of it. It was fucking pink. It was done. And I was like, I'm never cooking again. Like, I just give up. I'm easily distracted, and I'm getting better. But anyway, I cooked some chicken in the oven, and I was like, and for normal people, this is probably like, you're an idiot. I just don't do it because then you have to wash the pan and you have to do this. So microwaves are way easier. Even like the air fryer, it's so much easier. We live in a society where it's like, you gotta go. You don't have time to like plan a meal and do all this prep work and wash all the dishes and spend time with your kids. And it's like, so path of least resistance oftentimes is food, and that's why we all eat like shit.
So obviously, though, the microwave, there's a little bit of sounds like a remodeling space issue, but also a big health decision. We could have had one.
Yeah, we just chose not to.
Yeah. I mean, you could have set it on the counter, so it was definitely a health decition too.
Yeah.
Did you eliminate the plastics as far as like storing stuff? Are you
Most
all
of them.
Glass now?
Most of them. We do have some like the big Tupperware things. We've got like, I don't know, 4 or 5 of those left. Honestly, we just started saving like the like pasta jars or whatever from Costco. We just started wanting pickle jars, things like that, and I just put my leftovers in that. Honestly, I use it for my iced coffee when I take to work because they don't leak and they don't cost $40. And we have just started kind of using that for our leftovers instead of using plastic. You know, people think about things like, oh my God, stuff's so expensive. And yes, it is. But get creative. Like, use the freaking pickle jar. Like, you can shove soup in a pickle jar. You can shove leftover corn or green beans or whatever in that pickle jar. And then guess what? You ain't getting the plastic. You didn't spend any extra money because you already bought the pickles. Just using what you have.
Yeah, I used a pickle jar to put my coins in, which I never get. And, I soaked this motherfucker for hours.
You have to, otherwise everything smells like pickles and garlic.
Well, I was like, oh, it smelled so good, like Dawn dish soap. And then I put all these coins in it, and I opened it yesterday, and all the coins smell like pickles.
Yeah, you gotta do like... So you gotta soak them. I usually do like a vinegar or baking soda and just let them soak for like 24 hours. I let them sit in the sink, which drives my very organized husband insane. But you gotta let them soak for like 24 hours. I do the baking soda vinegar soak and just let them sit, and then I'll run them through. You can just rewash them, or I'll stick them in the dishwasher. And then usually that gets rid of. Sometimes they need a double soak for certain things. Like there's one like garlicky sauce we use from Costco that like that thing is infiltrated with smell, and it's wonderful, but not when you're going to put like grapes in it.
Right.
Because then they taste like basil, and that's disgusting.
Where did you become privy to the microplastics in that conversation?
I don't even know. I mean, probably the internet, just being open to other people's opinions, and Instagram probably, if I had to be honest. There's a lot of alternative thinking out there, I feel like, on Instagram. And just realizing it just ain't good for you. It's easy. But then you look at people our age and, you know, really like 10, 15 years before us and after us, it's like, look at all of our health problems. And it's like, well, that's when women started working more, less people in the home, more convenience. Hey, I can throw a couple of ramen noodles in there and to the microwave for 2 minutes and have a meal and not have to worry about cooking dinner. Like, it got easier, and now everybody's more unhealthy. It's like, and I'm not here to say don't have a microwave. If that's your, like, one of my friends, like, I would die without a microwave. There's no fucking way I'm getting rid of it. That's fine. But how you get to pick what you want to do. Like, there's no way on this planet Earth right now you could make decisions that allow you to be 100% healthy. Like, just based on what the ground has absorbed into the groundwater that we have to drink, you can filter it to death. We're still going to be exposed to crap. And so I'm not here to say, like, you have to do this, you have to do that. It's a matter of, like, choosing the things that are important to you and making those choices. So, like, microwave is one of those hills people just aren't going to die on. But plastic's an easy one. Like, I mean, but again, it comes down to what your priorities are.
You say it's easy, but it's really not. I mean, because it takes discipline to get rid of that. And, like, what about plastic water bottles? Do you try to avoid those as well?
I would say it takes a decision, and you have to triage what's important in your life. And it can be hard, but, you know, for me, water bottles at work was one of those things. And it's like, okay, well then go to the thrift store or go to Marshall's and buy a stainless steel cup for $10 and leave it at work. Leave it in your car. Take it with you. Get a bigger purse so you can throw it in. I have a huge purse, and I have a 40-ounce cup in it almost all the time. And 9 times out of 10, I can find a water faucet. Am I gonna drink a bottle of water if I forgot it? Like, yeah, it's fine. I'm not gonna argue that. If I'm gonna throw, you know, if I'm in Jamaica or the Bahamas, am I gonna drink out of the faucet? No, I learned that lesson in the Dominican Republic, so I'm not gonna do that.
I've heard the Dominican water is absolutely undrinkable.
It was so bad.
Did you get pretty sick?
Oh my God. I learned why there were 2 bathrooms in our room very quickly.
Oh God. I heard Mexico's the same way.
We are Sandals hose because Sandals has like a reverse osmosis water filter, and that's why we didn't know we went to the Dominican not to drink the water, because we could drink the water there at Sandals because they filtered their water. It was bad. I also got COVID on that trip, and I was cold when it was 90 degrees, and they were like, something's wrong with you. I was like, I'm fine.
Do
then
not
I was like,
test me.
Yeah. Luckily, we were past that point, but I was like, oh, I can't smell anything. Great.
Yeah, they said, I went to Jamaica, and they said you could drink the water. It was at a Sandals, but I was like, I'm not going to risk it.
I've drank water at Sandals every single time, and I lived. Dominican was not sandals, and I did not live.
So when you began coaching and offering this advice and affirmation to people on their journeys, who were your mentors? Or when you started jumping into the space, how did you start going this direction?
In the beginning, honestly, I was kind of a lone ranger, and I was just reading and absorbing all that I could. And I just kind of got to a point where I felt like I needed a little more guidance. So backstory, after COVID, I ended up leaving the ER. I worked in a nursing home for the longest 9 months of my life. And then, because it was going to be an easy schedule. It was so bad. And then I went and did orthopedic trauma surgery and urgent care for a few years because the schedule worked better for the 24-hour shifts. And my kid, it's like getting somebody to watch your kid for 24 hours is like impossible. And so
especially someone you trust.
Yeah, I have big trust issues with my kid. We were going to stalk her for her field trip that they're going to the Nelson Atkins because they couldn't have adults. And Colby and I were like, we're going to have a date at the Nelson Atkins this day, even if we can't go with her. I'm like, we are those parents. But I think that goes back to like, we see some shit and we have trust issues with people.
Absolutely.
And we're like, I don't care if I'm a helicopter. I don't care what the teachers say. I don't care what anybody thinks. I'm going to protect my baby to the end. I forgot what that question was going into. Coaching guru.
Yeah.
Okay.
And your mentors, like who did you develop your program after, if anyone?
So after COVID, I was like, this is not fucking working. Like people are unhealthy. I'm miserable. Like I'm working my ass off. I'm trying to help people. I can't follow up with them in the ER. People are not being listened to, and working in ortho is when I figured out I have hypermobile Ehlers-Danlos syndrome because there was a patient that came in and she told me about this and I was like, that's weird. And she started telling me about all these things of like circulation issues. Her fingers turn cold and she has a lot of allergies and she has, skin issues and she has joint issues and just all of these things that were like, huh. And then the orthopedic doc I was working with was like, that's like one of the worst things you can have because there ain't shit you can do about it. And I was like, that's crazy. And so I started reading into it and essentially self-diagnosed myself. And, they say, don't self-diagnose yourself off the internet. But I'm like, I also have a degree that allows me to diagnose and I know how to use the literature and I know how to do the screenings and I'm positive for all of it. So I feel like that caused me to dive into looking into the unseen for people that are miserable that no one is helping. And I really just had a passion for doing that in some sort of way. And I didn't know how yet because I had to do all that work on my own. And I'm like, how are people who don't have any kind of like medical training, how are they going to do this? They can't. The main thing that launched me into this was like, I'm tired of working in the hospital all the time. And so that's when like the GLP-1s got really popular and people were doing online clinics, and I did several months of training and started my own clinic in a state that was full practice. In Kansas, nurse practitioners don't need a collaborative physician. And so I started my own clinic and I ran it for 9 months prescribing GLP-1s. But my mission with that was not to just give people drugs. And an easy out. Like somebody wanting to lose 10 pounds and get bikini body ready wasn't my jam. I was more into like one of my clients was a teacher. She was 5'2" and weighed 348 pounds. And she lost 12 pounds in the first month. And I just sort of organically started coaching these people through making these lifestyle decisions while they're using that tool to get their life to a better place so that they can walk up the stairs, so that they can continue to do their job and not have to go on disability, and seeing them succeed in that way was really where I was like, one of my clients, when I was like, it got to the point where Eli Lilly, the big companies that do these GLP-1s, were starting to go after and sue med spas that were prescribing off-label GLP-1s. And to be clear, there's a way to do it and there's a way not to do it. The way not to do it is to use these for research only. You don't know what the hell's in those. There's no clarification of what medication is in there, if it's even what they say it is. And there's a way to use a real pharmacy. So like a 403B compounding pharmacy, every ingredient that they use in those pharmacies are FDA approved. So the end result, which is the semaglutide with B12 in it, or the, tirzepatide with B12 in it, that final bottle is not FDA approved, but every ingredient that they have in their pharmacy is. So you're not getting some just BS medication, right? So using authentic medications with that, I wasn't for like, let's do this and make money. I was way undercharging and I was coaching all these people, but it's when Eli Lilly started to go after people and say, oh, well, you're stealing our stuff and blah, blah, blah. And whatever. I won't get into that. But basically it was at a point where I was like, it was like they were saying you can't do this. I mean, they're making insane amounts of money. They were charging one thing in the US and another thing in the UK. And it's like, why is this different? For people that truly need it, it's horseshit that we're just, the elite can get things that they want. I think Eric Dane, who just passed away from ALS, he was an actor that, he was,
shout out
Dr.
Grey's Anatomy.
Yeah. Dr. Sloan and Grey's Anatomy. But he ended up with ALS and he recently passed away. And one of his things was like, he wanted to raise money so that the treatments that he was able to get because of his financial status is available to every human, because it's not fair that people who are actors and have a lot of money have access to things. Even GLP-1s through a med spa now, it's like they're still not super cheap. And it's like you look at poverty and you look at the health. It's like people that are in poverty are more unhealthy. They need more access and they don't have it. And so, I basically just broke even on my business because some clinics were charging $1,300 a month and I was charging $350, and I was not just giving a medication. I was spending, 2 or 3 times a month with these people working through coaching. And so I started coaching kind of before I realized I was coaching. And one of my clients was like, please don't leave me. Like, I just was at a point where I was like, am I going to stick my nose in the sand and just pretend this stuff's not happening? Because the pharmacies were not dispensing the medications. They were putting holds on it for like 2 or 3 weeks, and people were like, where's my drugs? Like, so I had no other services. I had no interest in going into primary care, or doing any of that at the time. I ran the whole thing by myself. So I was just trying to stay focused. Or do I just quit where I'm at? And I just was at capacity at the moment. And I had fear in dropping that ER stable position at the time. And so I closed it down. And, but then it got me thinking that one client, well, I had several clients that were like, oh, can you just be my doctor? And I'm like, well, I'm not a doctor. I'm a nurse practitioner and blah, blah, blah. But I kept thinking about it. And then, of course, as the algorithms do, they start bringing things into your space. And nurse coaching was something that started coming up. And so I just started looking into that. And so I did a 9-month certification called the Nurse Coach Collective, and that's where I got certified. And then I found my business coach, Jess, and she's actually somatic and energetic. She's a hospice nurse. She's been a hospice nurse for a long time. And now she's a business coach and a somatics coach. And I was going between that and just like a straight nurse coach, business coach. My dad was diagnosed with cancer, and there was just a lot of family drama going on. My nervous system was a fucking wreck. Between, post-COVID, raising a baby by herself, basically, like our schedules being insane, like trying to do marriage, that's hard, especially with our schedules. Just a lot of dynamics. And I just felt like even from childhood, I've just always been like, go, 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 which is probably why I landed in the ER, right? And I was tired of that. And so Jess's program really spoke to me. And so she's still my coach to this day. I've been with her for about 1.5 years. And I do think that's where my undertones of like nervous system dysregulation come from, is like integrating that somatic work and breath work and meditation and hypnotherapy and all of these modalities that like most people don't know what the hell they are, and they sound weird and hippie and woo until they do it. And then they're like, so I did a breathwork session with one of my ER physicians. He was at the head of the number one healthcare corporation in America. He was at the top for a while, not the top, but pretty close. I did a breathwork session with him. We keep in contact. And he was like, I don't even know what you're doing, but this is the most relaxed I felt in 10 years. So that testament to this work is really what, his opinion weighed heavily on me. I'd worked with him as a nurse. He was a doctor. I'd worked with him as a nurse practitioner. And the fact that somebody who has been in ER for so long, decades, it had that sort of impact on him. And he was one of my first pro bono clients, was like, this shit needs to get out there. And this is the basis, like getting your nervous system in line and regulated is what allows you to reach your goals. And to, if you want to lose weight, if you want to eat better food, if you want to have better relationships, if your nervous system is not on a line, you can't get there. Like, it's like you got a wobbly car. Like, you got to put your tires in alignment to be able to drive your car. Otherwise, the wheels are going to fall off.
I never thought about it like that. So you see that as the core principle. The first is the regulating your nervous system.
It's what every one of my clients comes down to. Like, most of my clients come to me and they're like, I want to lose weight. I want to be less stressed. Honestly, less stressed is like the biggest overtone of everybody anyway. And stress is a dysregulated nervous system. You know, you can't lose weight because you're constantly stressed and your energy is going 100 different places. It comes down to nervous system regulation every time.
When you worked at your own practice, did you have the autonomy to adjust the dosages of the GLP-1s?
Yeah.
Because a lot of the literature is saying, like, I think it's a fucking miracle drug. It really is. But a lot of people who do have that autonomy say that it's given at like a 10-fold dose or at least a double, no matter where you get it, even if you get it from like Hims or Hers or whatever. Did you notice that you were starting people on quite a bit less than like what they would get from their PCP?
So I started in it like 2021. So I was like way before microdosing was a thing, but I definitely was like, I always started at the lowest dose. Like tirzepatide was like 2.5. But I would always tell patients, I'm like, if it's giving you a lot of symptoms, cut it in half. It's like blood pressure medicine. If your blood pressure medicine dumps your blood pressure and you feel dizzy and pass out, what are you going to do?
Titrate.
You're going to half the dose. Like, this isn't a matter of like, you have cancer and if you don't take this whole vial of medication, you're going to die of cancer. Like, that's not what this medication is. It's not insulin, but it's not unlike insulin in that insulin is, if your blood pressure is 500, you're going to get a 9-unit dose. Titrate it to what you need. So I would say I was a little rogue in the beginning of just like, listen to your freaking body. Like, no, I'm not the kind of person that's going to be like, oh, your blood pressure is 260/110. Listen to your body. Just do whatever you think is right. No, bro. Like, if you don't take your blood pressure medicine and get your shit and your diet and everything under control, you're going to have a stroke. Like, you should take this. But I think when we're doing it for symptomatic relief and lifestyle changes, I think there's lots of wiggle room. And yeah, I definitely was on the, you know, I'm not going to make you go up to 10 milligrams. Like, there were a ton of people that were like way up there. And I was like, it's not working because you ain't doing the other stuff. You're not drinking your water. You're not focusing on your protein. If you don't drink water and have protein, you're going to be puking your guts up and you're going to feel like shit. Like, you're going to lose your hair. You're going to lose your muscle mass. Like, all of those things. So.
God, that made me lose my train of thought.
I know.
I was going to ask you, dude, what the heck were we talking about?
GLP microdosing.
Yeah, GLP-1s, microdosing.
Listen to your body, having strokes.
Yeah, is it difficult for you to, when you have a client on the coaching side, is it difficult for you to stay in that role because you've done a lot of emergency medicine too? Like, do you have to really separate them? Or have you found a way to house them all in like an inclusive?
Yeah, it's all nuanced. It's all gray. I live in the gray area. You know, I had a client come to me and they had gotten their GLP-1 from a med spa and they ended up in the hospital. They ended up in the ER they couldn't quit puking for like a week. And she was also a nurse. And I was like, I can't prescribe you or tell you what to do with what you're being prescribed by someone else, but just send me a picture of this. She sends me a picture and it says for research purposes only. And I was like, this shit should not be being prescribed by somebody with a license. Like, that's just poor prescribing. So just more evidence of like, even people with licenses, you gotta keep people in check. And I was like, I can't give you, because I was gonna like be like, well, if you're not tolerating this and you're taking too high of a dose, you could consider decreasing your dose. Of course, following that up with check with your provider if they're okay with this, blah, 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 blah. But I was like, I can't give you recommendations on this because it says for research purposes only. You don't know what the hell's in that vial.
Right. And
so it's like a checks and I can serve as a checks and balance too for people.
And a lot of those drugs come from China where they're made in the same vats that like steroids are made. And that was the big thing with like C4 drinks back in the day, probably when you and I were in high school. They got pulled from the market. So there was a company called Muscle Farm, and even their protein, they found out that it was being made in the same vats that they're making steroids, and so they called it like amino spiking or whatever.
Yikes.
But yeah, crazy stuff.
It is crazy stuff.
Do you have goals to take what you're doing now and maybe open some brick and mortar thing later, or maybe even make it full time?
Full time is the dream. You know, I say that I'm not at a point in life where I want to be done with the ER yet. That need for adrenaline showed its face when I was in the nursing home and even in orthopedic trauma. I mean, granted, the hammers on femurs in the OR were not like something I'd seen before. It was great, but there's something to be said about that constant, you never know what's coming. Like, it's always a challenge.
It's a drug and a dopamine rush in
it
itself.
It sure is, but it's also a challenge. And I'm like the other day, this guy, what did he do to his finger? I don't know if it was some sort of saw, table saw or whatever, essentially amputated one down to the knuckle almost, and then another one was partially amputated, and then the other one had a big lack. And it's like, this is just a big puzzle that I get to challenge myself with. Essentially doing a stub revision in the ER, washing it out bedside. Like, this is a surgeon's job that I get to do. And I'm not claiming to be a surgeon. Obviously, we're like the medic on the field. We're just like, we're going to tack it together so that you can stop bleeding and get to the person that needs to do it. But when that surgeon sees it, it's like, dude, you killed that. Like, that was great. Like, that's just, we need to have things that we get positive feedback from in life. And I enjoy getting that. I enjoy getting to help people. I enjoy getting to run into people that are hypermobile in the ER that have no idea. And I start going over things with them as quickly as I can in my 5 to 10 minutes. And just giving them that little piece of cheese to chew on to be like, oh, all of this is making sense. And I'm like, here's the rabbit hole you can go down on your own. And here's a resource you could talk to. Usually it's a physical therapist of like, hey, this person knows about hypermobility. Go see them. They can help you out. So I'm not ready to like fully be done with that. I'm part-time now, actually. So I'm doing coaching part-time and ER part-time. I'm also doing, I'm kind of, in my elder years, I'm sort of finding that you need to do the stuff that makes you feel good. And the ER makes me feel good sometimes, not all the time. You get into like the politics and the administrative stuff, and that's really what drives me insane. And the lack of being able to treat your employees like humans. But the job itself is fun most of the time. But then you get into coaching, and I get to watch people who, in the ER, people come in because they're in crisis. It doesn't matter if they stub their toe or if they cut their finger off. It's probably close to the worst day they've had in a long time. And so everyone's in crisis. Whereas coaching, you get to take care of people. I get to take care of people that are ready to make change. So like, I don't know what this looks like. I don't know where to go from here. Help me move forward. And getting to see people go, like one of mine, I coached a firefighter, and I didn't know how it was going to go because I hadn't coached a guy before, and I was like, oh man, like, how's this going to go? But I feel like in general, guys who show up are ready to do the work and they'll just freaking do it, whereas females will sign up to do it and then they're kind of like, oh man, I don't know what I got myself into it, and less dedicated almost. But we started with, he was on his phone like 4 to 6 hours a day, and his kid was like, having fits, throwing fits, being crazy, driving him nuts. His spouse and he were like arguing and having situations, And by the end of 3 months, I mean, through just coaching, breathwork, that kind of thing, he was like, I'm on my phone less than an hour a day. I'm creating a business. I'm considering writing a book. Like, I'm getting up at 5 a.m. and working out and cleaning the house and getting breakfast ready for my spouse who's getting ready to go on shift. I get my kid to school. I come home, I work out, I pick up the house, I am ready to go. And then I have a whole day to just do whatever I want to do. And his mood was so much better. His patience was better. He was like, me and my spouse are getting along so much better. And none of this was through like some like, here's step A to Z. It was all nuanced. It's all, okay, what's working and what's not. And if it's not working, fucking get rid of it. Like, stop doing it. Stop forcing yourself into this box that's not working for you. When you start listening to what you need, when you stop listening to what you need, start listening to what you need, things start to shift and change because you have trust in your own intuition. Things get easier. And so being able to watch people go in 3 months, sometimes 6 months, in that short amount of time for your life to flip that significantly is so cool to get to see that. And that's when then people start meal prepping and they start going to the gym and they start, having healthy conversations and they start going out with their friends and socializing that they didn't have the energy for before because they've prioritized what's important for them. Getting to see that is why I do coaching. And then I'm actually working with, it's a direct primary care clinic in Warrensburg. I don't know if I can shout out Casey White with Midwest Healthcare and Wellness.
Casey White.
She's doing some big stuff. It's essentially what we're talking about. It's cash pay. It's not insurance, so we don't have to check any boxes. We don't have to do whatever insurance tells us to do and not actually get to help people. Like, we get to do gut health and run those kinds of panels and do more functional wellness type stuff. Integrating like more just holistic nursing into it. And that's a really cool space to explore. Somebody can pay $150, come in and get sutures and an x-ray or whatever they need for under $200, which is basically an ER copay. And you don't have to sit next to some hobo that's asking for a turkey sandwich and got bed bugs. Like, what are you going to pick? Like, plus it's personable. We have time.
They're going to pick the hospital. It's free.
Well, if that's definitely there are people that have to choose that. And that's the unfortunate part of medicine. But, when somebody has to pay a $150 copay, that's, people that are accountable and are going to do that, they're going to say, do I want to pay a $150 copay to go to the ER, or am I going to pay $150 to go down the street and have somebody that's actually listening to me and not having to just deal with all that crap?
So do you feel like you get similar satisfaction value out of a result in coaching as you do from helping somebody in a acute emergency?
Yeah.
Or is it a totally
similar.
Different type of?
It's similar. I don't think one replaces the other, but I think it's a similar type of satisfaction, if that makes sense. I mean, I get equal satisfaction of, I went into healthcare. I think most people that do, we go into healthcare because, we want to help people. And that usually stems back to us not having been helped in situations in the past. And, I think in whatever fashion you can do that, do it. You don't have to just, and I think in corporate America, a lot of it is like, oh, well, you worked at this hospital, you need to stay here, you need to be loyal, or you can't switch because, then it looks like you can't hold down a job. I also think that's bullshit. I think you need to listen to your intuition and like, how can I best serve people? Because you can't serve people to the best of your abilities if you're not happy. I mean, you and I have both seen, medics, EMTs that are just in the job because they've been in it forever and their pension's in it or whatever the case is, and they just don't fucking care. They're just driving an ambulance, and this is not everybody. I mean, you have nurse practitioners that are that way. You have doctors that are that way. You have attorneys that are, people that just show up because that's what they think is expected. I look at those people and I'm like, what would your life look like if you chose to pivot and did something that felt good to you?
Yeah, and we've all went through those phases, I feel like, too. And when you're in one, just reminding yourself that it's not always linear.
Yeah.
And sometimes you can get out of that and really enjoy your job again, but it takes effort.
I left emergency medicine for a couple years.
Yeah.
And when I came back, I was able to have a new appreciation for it because of that. And when I tell you, walking out of that ambulance bay for the last time, like, it was a gut kick. Like, it was fucking hard, man. Like, I'd been in it for full time for 10 years. It was part of my identity. And to walk away from that was insane. I would still do it again. Ultimately, I didn't stay at the nursing home. I didn't stay with orthopedic trauma and urgent care. But I learned so much in both of those places, things to do and things not to do. But just the orthopedic knowledge helped me a ton. We read all our own x-rays and we didn't have radiology overreads. We had to know what we were doing. That increased my ability to be a good nurse practitioner in the ER tenfold. Easy. And if I'd never made that decision to walk away, I wouldn't be the provider that I am today. And so realizing that your gut has a reason for pushing you towards something and that, like you said, it's not linear, you can always go back to it.
Yeah, I've taken breaks a couple times and then I always miss it. So I know like there's something there, but it could be just as bad for you as it is good.
Yeah.
What about the difficulties making a business out of a passion? Like, what have you experienced there?
Imposter syndrome is a big one.
I was going to ask, is it hard for you to post as much as you do?
Dude, I am that.
Let me just gas you up then. Like, I really appreciate how you put yourself out there because I know how it is. Like, I'll post something here that I'm really proud of, and then I'm, like, anxious all night because I'm like, oh, my God. Like, I said on a podcast one time, I said that life starts at inception. And I was so embarrassed. And I don't know. And I just, I'm a little bit better now, but like, especially the first few episodes we did, it killed me. So I like, just to tell you how much I appreciate you doing that because we need more people like you. But I hope that doesn't get to you, even though I know it does, because it does everyone.
Yeah.
But that must be because you have to post. It's your business. You
Nobody
have to
knows what you're
it.
doing if you don't post it.
Yeah, and then they also, like, and it could be a little bit of, like, ego, but there's people that are like, can you see what Allie's doing? I can't believe she thinks she's going to be. And you're like, God.
Oh, I for sure have somebody 110% I know that's doing that. And it's funny because I know who they have looking at my stuff because it's like they're looking at my story and I'm like, oh, you think I'm dumb. It's fine. I think shielding, honestly, energetic shielding has been a game changer for me because in the beginning when I was doing my semaglutide thing, like I felt like the biggest frauds making TikTok. And I don't love TikTok, but like it's certainly a way to reach a lot of people. And honestly, I look at it from like a global perspective of like people that are on TikTok all the time, they really need some nervous system regulation. And so I try to create more than I consume. For sure. I'm as guilty as anyone of getting sucked into it here and there. But I struggled with it a lot in the beginning and I felt so stupid. I felt like a giant fraud and that I didn't deserve to be doing these things and that people thought I was going to be stupid. And through my like energetic path, if you will, we talk about energetic shielding and truly just setting up a shield between you and the outside world. Can really just cut some of that shit down where you just don't give a fuck. You're able to just like, does this matter? Am I truly doing this with intention of good intent for other people? Yes. Am I going to mess up? Yes. Like, do it messy. Like, take the next messy step. Like, people that are successful in business aren't the people that set a plan from A to Z and it's perfect. Because the person that does it messy is going to get there before that other person and they're going to be successful. And if they're not successful the first time, they're going to do it again and they're going to recreate it. And that's how you build on it. Because honestly, it's just like learning as a new medic or as a new nurse practitioner or nurse or whatever. You learn the most from the things you fuck up.
Yeah, and the people that really matter are going to scheme a shift because I'm guilty of it too, especially seeing women who like do the pyramid scheme makeup things and I'm like, it was fucking idiot. Yeah. But now I'm like, you know what? They think that they're building something greater for themselves.
Some of them do.
Some of them do.
Some of them fucking make it.
Absolutely they do.
Delusional. You be delusional about anything and I think you can make it happen.
Well, even if they stay with it for a month, you know what? They learned a lesson and they're trying, which is much more than the haters and the negative people online can say.
Yeah.
So that's how I view that now. And yeah, I'm super grateful for what you do, really, because I think we need more people, especially with how everything's unfolding. I think a lot more people have skepticism, especially healthy skepticism of the FDA and everything that's going on and medications and over-medicating. And
over-medication is just a thing.
Polypharmacy is huge, and we've seen, like, just since COVID, how much you can't trust anyone, and then they want to shut you up when you go against the mainstream narrative. So I think what you're doing is phenomenal.
I appreciate that a lot. My goal is to give people autonomy and in a safe way and in a way that improves their life, because doctor's appointments look like a 15-minute, my husband went with me to an appointment recently. And he was just like astonished. He was like, what the fuck was that? Like, I went in for a rash on my face that had been there for 9 months. And it was like a localized rash. It was very autoimmune picture. And I was like, hey, can I just get some labs? And they were like, oh, you work in the ER. It's because you're anxious. Would you like to start an SSRI? Would you like some therapy? I'm like, we can't do labs. And I said, no, your autoimmune labs were normal 3 years ago. We don't need to recheck those. And then they wanted to make sure to give me my flu vaccine. They wanted to do a pelvic exam. And I'm like, you want to do all the things you can bill for. You don't actually give a shit why I'm here. And I was like, she's like, well, I guess if you wanted to go see dermatology, you could. And I was like, literally, my chief complaint was rash. So that kind of catapulted me more into it. But my husband too. I mean, he's like, that's insane. Like, they didn't even address the thing that you were there for.
Yeah, but how much stake do you put in that being that one-on-one provider that you had? As it's almost like an indoctrination from the top.
It is. They don't know any better.
Yeah,
and they don't have time to look into other stuff.
And even if they did, they can't go there and spray that nonsense at their clinic.
Or they go start their own direct primary care clinic, which is what a lot of doctors are doing.
Yeah.
Which allows them to smudge the borders a little bit, because the borders need to be smudged. Like, it's not a one size fits all. Like, I have a friend that was talking to me about their blood pressure being high and their cholesterol being high and this and that. Like, the doctor just throws medication at you. Do you think they have an hour to sit down with you to talk about diet, nutrition, nervous system regulation, decreasing your cortisol? Like, my weight has fluctuated up and down like my entire life, and I will tell you, the easiest it was to lose weight was when I was doing yoga and meditation and got my shit under control. Like, my nervous system, my intention was not losing weight at the time. It's a holistic picture, and Western medicine just is not that.
We're behind the 8 ball when most people think we're the most prevalent, you know?
Yeah. It's easy and quick to be like, here's some labetalol for your blood pressure and come back and recheck it. Like, and you know, they'll give the disclaimer of like, you need to work out 3 times a day or 3 times a week and, you know, eat better. And it's like, I asked somebody the other day, I was like, so what's your diet look like? What do you eat? And they were like,
can't wait for this.
Well, we eat mostly Mediterranean diet, and they're there for like chest pain, their blood sugar's high, their blood pressure's high, they're like 28 years old, they're significantly overweight, and they said, well, we eat mostly Mediterranean. And I said, okay, what does that look like? Well, you know. And I was like, they couldn't come up with anything. I was like, well, what'd you eat for lunch? Well, tuna helper, and they're drinking Mountain Dew. I shit you not. They're drinking Mountain Dew, like, in the ER. And I'm like, I'm not saying you can't have balance, but like, I think you just are not lining up with actually what a Mediterranean, because you ate tuna helper is not Mediterranean, like, because you put some canned olives in it. Like, we gotta like narrow it down. And if you don't want that to be your priority, but I think people just get delusional and back to the like, oh, well, it's genetic. I got complained to a patient advocate because somebody was pregnant and they were hypertensive and they were saying they were preeclamptic and they didn't meet any of the criteria for it. They were significantly obese. They were on their 5th pregnancy. She had Cheetos in her purse that she was eating. She had a Mountain Dew or some sort of equivalent soda. And I sat down with her, and I bring my coaching to the ER when I can, when I have time, because truly humans need that. And it just wasn't working. And I was trying to give her a resource. She's like, you don't understand. I have 5 kids and I'm working in a factory and blah, blah, blah. And I have preeclampsia and I Googled this and blah, 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 blah. And I was like, I'm just offering a free resource. There's an app called Nourish that they accept 98% of insurance. You at least get a couple visits for free. And
what is it called?
Nourish.
Okay.
It's called the Nourish app, Nourish. You go put your insurance information in there if you have insurance, and they run it. And then you can use click boxes to say, hey, these are my issues, whether it's constipation, irritable bowel, I've got food allergies, I've got X, Y, and Z. And it gives you a list of people that are familiar with those things, and then you can meet with them on Zoom. It's super freaking easy. I think I got like 6 or 8 visits that insurance covered. I think every human should talk with a nutritionist. I have had nutrition training probably more than most. When I did the weight loss, I did additional nutritional training, and I just learned so much. And I was just simply trying to offer her this resource, and she was like, you skinny bitch, get the fuck out of my room. I want the patient advocate. You're harming me. You're blah, 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 just this and that. And like, the social worker came down and was like, oh, and she said I was gaslighting her. And I was like, there's a difference between like gaslighting and there's a difference between like reality of like, I said, look, you're going to be preeclamptic soon. And you've got to make some changes, or you're going to be. Also, she was non-compliant with the medication she'd been prescribed for the thing. So this was obviously somebody who just was not in a space. She was stuck in fight or flight, obviously. But, you know, it's like not being delusional about what is science and like okay, you can't say it's blue when it's pink. Like, you can't say you're doing everything when you're eating Cheetos and drinking Mountain Dew. And like, but coaching allows that nuance. And it's people that come, you know, and that's not a person I could coach, right? She was not in a coaching space. Finding those coaching people are like the people that are ready to make those changes and willing to look in the mirror of like, okay, what am I doing that I can change? Those are the people I'm wanting to, that I work with.
Do you remember Kyle Stillwell?
Yeah, Kyle. He was weekend option too.
He what?
He was weekend option.
Yeah, exactly.
Yeah, so he and I work together a lot.
Does he still run that clinic across the border in Iowa?
I have no idea what he's doing. I lost track of him when I left. What clinic was he running?
Well, he did the thing because in Iowa you only have to have the NP, and his
Is
wife,
he a nurse practitioner now?
His wife was.
Oh, okay.
And I think he was getting his, but
Okay.
they were opening something, and I think it was going to be like functional.
I'm gonna have to track him down.
You should. Yeah.
Oh, Kyle, he saved my ass one time. I pushed a med that I had a patient yelling at me, and I was a baby nurse, and I pushed a med that was supposed to be IM, and I panicked, and it had atropine in it, and she kind of got weird for a second. I was like, Kyle, and he's like, oh, honey,
She'll be all right.
We used to push that in the IV all the time. They just changed that a few years ago. She'll be all right. Give her some fluid. She'll be okay.
I could chuck an 18 in her butt crack from across the hall.
I can see him doing it in room 3 right now.
He had no patience for the doctors. He was just too smart.
Yeah. He and I clashed a little bit when I was charging because he was obviously senior to me. And I was very much like not trying to ruffle feathers, but also I needed him in a different spot than the one he was in. And I put him at triage and he got real mad at me. He didn't want to be at triage.
He probably got over it.
He hated triage. He wanted to take the trauma patients. I'm like, I get it, but I got nurses that got to learn how to do traumas too. So I'm sorry and shit, but it was fine. We got along great. He gave me words and I gave him back and it was fine.
I saw we.
Yeah.
Well, hey, thank you so much for doing this. I really appreciate it. Unless you want to comment on ivermectin and then we can.
I don't really. So, I mean, I have some thoughts on it. Interestingly enough, my very first patient of mine at my very own baby clinic for semaglutide was this farmer from the middle of bumfuck nowhere, Kansas. And he's in his tractor on Google Meet. How he figured out how to do it, I'll never know. And he's like, what are you talking about? And I thought he was obviously there for weight loss. And because I'm like asking all these questions and he's like, well, honey, I thought you were prescribing ivermectin. Somebody's. I was like, no, sir, it's not my specialty. I'm not opposed to it. I don't really know anything about it. And I don't think it's appropriate for me to be prescribing it when that's not like my thing. I don't want to do it incorrectly, right? Like knowing your limits. And so that was one thought. And then my second thought was, my dad was diagnosed with stage 4 lung cancer a few years ago. He actually passed away back in June.
Rest in peace.
Yeah, it was shitty. Cancer sucks, and that's another motivation of mine to just do as much as you can to avoid the shit that's trying to kill us, like plastics and chemicals and all the things. And we're not going to be perfect, but decreasing the load, certainly. He was a farmer and he bathed in Roundup for years. I mean, he did smoke and stuff too. You know, he certainly didn't live the healthiest lifestyle, but he was an old farmer. Like, he took forever to die just based on the fact that he was like healthier than 90% of the population outside of his smoking. And, you know, he had his days of drinking and all the things, but pretty healthy guy outside of that. And, you know, kind of towards the end, he had questions about it. My aunt is definitely more on that realm of more alternative treatments, and I'm not opposed to them, you know. And when I look at somebody with stage 4 cancer, do whatever the fuck you want. Right. Whatever the fuck you want. If you want heroin, if you want mushrooms, if you want ivermectin, if you want, I don't give a fuck. I think people who are dying they deserve dignity. And I don't think anybody should have an opinion on what the fuck they want. And unfortunately, his significant other was very opposed to it and didn't allow him to have that. And so he was having conversations with us and he really wanted to do it. And unfortunately, when he got the strength to be like, I want to do this, I'm doing this, it actually turned into a big spiral. I no longer talk to his spouse anymore. We're not associated. And because she saw us talking about the ivermectin, he wanted to do it. He wanted to try it. And at that point, I knew it was too late. He'd been talking about it for about a year, but I knew it was too late for him. And at that point, I was very like, I don't care what anybody else thinks. I'm going to advocate for my dad. And she spoke over him. And I said, hey, you know what? Like, let's let my dad finish his thought. Unfortunately, she has mental health that she's not accepted or being treated for. I'm not her provider or doctor, but I would suspect bipolar with narcissism personality disorder. And she flipped. She went manic and was screaming, and it didn't stop until my dad died. It was very unfortunate. But I won't get into all of that. But basically it was like he couldn't make that decision because of someone else's thought. And I hate that, like I think that people should die with dignity. I also took a death and doula course to be like a death doula. I haven't completed it yet, but that's something I'm very passionate about because of this situation too. I think people deserve to die with dignity, and I think the families need to respect that. And I think there's a way to bring energy work and things into that too, but that's more to come on that. But I mean, I do think there's some benefit to it. Like there are these studies, like my aunt's cousin, of course it's like twice removed, I don't know, but had this story where he had pancreatic cancer and like he's still alive. And so it's like, well, it's $10 a box or whatever. It's so cheap.
Don't they generally couple it with
fenbendazole or whatever? Yeah. So, I do have questions. Why aren't we studying that? Why aren't we doing bigger studies on that? Why have we not cured cancer, but we came up with a vaccine for a virus that we knew about for 5 seconds?
Yeah.
And who's getting paid for ivermectin? Nobody, because it's dirt cheap.
Right. Have you heard the Mel Gibson story about that at all?
No.
His dad had cancer, and I think he went to Tijuana, and he got like the ivermectin, fenbendazole.
Yeah.
Still living.
Yeah, and that's what I hate about it, is that my dad was suppressed enough that he just didn't want to have to hear about it, that he didn't do it.
Yeah. And at that point too, I'm sure he's exhausted from all the treatments that he's received.
Yeah.
And just the conversation of options.
Yeah. I mean, he was the old farmer at the beginning that was like, man, fuck chemo, I'm not doing that shit. I mean, and it was a toxic environment in his house. He knew about his mass about a year before it was diagnosed as cancer. He told my husband. He didn't tell me, but he told him. He knew about it. And I have suspicions why he didn't have it treated. Life was hard.
Yeah.
He didn't feel like doing it anymore.
Does hypermobility have anything under the same umbrella as Raynaud's?
Oh, absolutely.
Some of the stuff you describe sounds similar to
I have Raynaud's.
Oh, you have that too?
Yeah, the circulation stuff.
Is that a secondary, or are those both separate?
I don't know if there's an answer to that. It's like a comorbid condition, I guess you could say, of like it commonly occurs because of how the connective tissue involves your nerves. And I have it. I mean, I have a heated jacket at work so that like if I have to suture someone's finger together and my hands are frozen and I can't feel them and they're purple and white, I can stick them in my pockets, heat them up for a minute and do that. And my grandmother, my dad's, so I actually got hit from both sides genetically. They're not confirmed diagnosis, but my grandmother was the picture of Ehlers-Danlos hypermobility. She and I had a lot of the same things, but she always complained about circulation, and she would go see the vascular surgeon and he's like, oh, well, your flow is fine. There's nothing wrong with you, blah, 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 blah. She had fucking Raynaud's, and nobody caught it. They just told her she was crazy. So yes, it falls into that. People with hypermobility oftentimes have Raynaud's and MCAS, which is mast cell activation syndrome. So if you can write on your skin and draw your name with your fingernail, or if you're super responsive to just touch, you get really red with things. If you get eyebrows waxed or something, or tattoos, you get really red. Ears flushing randomly. People that have random anaphylaxis without a known trigger, oftentimes that's a mast cell activation syndrome from overactive histamine. GI symptoms can be associated with dysautonomia. People that have a lot of dizziness and tachycardia that's unexplained. You know, these young 20-year-old females that come in with a heart rate of 140 or they're in SVT. You know, oftentimes, because your brainstem lives right here, main source of my hypermobility is in my neck. And so I have craniocervical instability, which that's where your brainstem lives. That's what controls all of your body function. So it would make sense that you pass out and your heart rate spikes and you get cold and you get hot and you have weird circulatory things. You have breathing issues. I think the neck is a piece of the puzzle that we are missing. And there are only a few chiropractors in the United States that focus on this. There are very few spine surgeons that are familiar with this and even acknowledge hypermobility as a thing. I'm excited for the next 10 years, maybe the next 2 or 5 with AI and everything. Maybe this will facilitate this a little bit more to putting these pieces together of these people that are just getting blown off as anxiety. There's actually stuff to it. Yeah, like after my spinal epidural, I had probably a chronic CSF leak that was causing me to have shortness of breath, difficulties breathing, hypertension that was not related. Like I would be 116/60s. That's my normal. But then when I tried to do yoga or ride a bike or do things to lose weight and get healthier and move my body, if I bent over or moved positions, my pressure would shoot up to like 160/120. And I saw cardiology at KU and they're like, this is not a heart problem. It's not a vessel problem. You don't need blood pressure meds. And well, what did everybody say? Lose weight and it'll all get better. And it's like, to some degree, yes, I need to. But because of all the dysautonomia that was undiagnosed, I had a lot of trouble doing that. And so, again, that's kind of just what launched me into like, listen to your fucking patients. Stop blowing them off and saying it's anxiety. Why don't you listen to what they're saying and try to actually figure it out? So I'm hopeful. I know that the UK is doing a lot more studies on things like hypermobility, and the guidelines are actually supposed to be updated at the end of this year or early 2027, because the test is like, oh God, you know, like, can you bend your thumbs back? Can you do your fingers? Can you touch the ground with your legs straight? Do your knees hyperextend? Well, it doesn't take into account your neck. My neck lays on the back of my back. Like, that's not normal. You know, I can hyperextend my jaw. I can hyperextend my shoulders. I can sublux my SI joint and my hips. They're not fully dislocating. But none of those things are on the test for it. So some people might not have the things on the diagnostic criteria that are just getting missed because they don't meet the criteria. So those are going to be updated. And that's where I think we're going to start catching all of these other things that are just so misunderstood.
Is POTS a set of symptoms, or is that its own diagnosis?
I think, well, I mean, yes and no.
And it's kind of new.
It's newish. And you'll hear a lot about like, oh, well, it happened after a COVID vaccine or after having COVID. Well, it's viral mediated. And so there's something called chronic reactivated Epstein-Barr, which I also have, which is basically mono that reactivates when you're under stress. You know, if you're in fight or flight all the time, or if you are not sleeping or you get sick, like it activates. So it's like you can get the flu and a normal person is better in like 2 days. Somebody with chronic reactivated Epstein-Barr is going to be sick for maybe a month and a half. They're just going to be exhausted and tired and running low-grade fevers. And, you know, now we have this long COVID. There's some theory that long COVID is actually chronic reactivated Epstein-Barr, and it's just the same thing. They're not looking at it through, they're looking at it through different lenses. I don't know what the question was. POTS, yeah. But viral things, you know, the theories are that type 1 diabetes are mediated by a virus. They're triggered by a virus is what onsets diabetes, especially juvenile type. And so there's a lot of talk about COVID causing POTS. It stands for postural orthostatic tachycardia syndrome. But the thing with that is like, I have POTS type symptoms, but I don't meet the criteria of like the 20 milligrams or whatever per mercury that the textbook says it has to be, but I'm symptomatic of it. And like when I get sick, I am symptomatic of it. But other things can cause that. And so I think a lot of it, my internal theory based on absolutely nothing outside of just taking care of a lot of humans in 15 years and myself, is that it's probably just lumped into dysautonomia. So then we got to look at the brainstem. I also have Chiari malformation, and like how many people have a Chiari malformation, which is where the cerebellum kind of comes through the spinal cord and puts pressure on your spinal cord and brainstem and CSF flow, which gives your brain nutrients to function properly. Like people that complain of brain fog and things like that probably have some sort of flow issue with the brainstem. And it can be other things, but I think there's just a large proportion of people we're missing. But yeah, I mean, it is its own thing, but I do certainly I mean, a large portion of people with hypermobility have POTS, to the degree that they end up getting ports and having to have IV fluids because their body, their connective tissue, their vessels don't squeeze like they should because they're just so lax that they don't pump the blood back like it's supposed to. So they need more volume. I mean, some of these people, and this is not a recommendation, but like some people say that their cardiologist has them doing 8 to 10 grams of sodium per day to keep their volume up along with fluids. And so again, yes, POTS is people are getting, but I look at it like, okay, feeling dizzy and faint. And a lot of time anxiety is the complaint because when your heart's racing and you feel short of breath, you're going to feel anxious. And when that's corrected, the anxiety goes away. So it's not an anxiety problem. And I think medicine has gotten so far away from ruling out the physiological problems and just going straight to anxiety because you're a young, whiny female is out of control. But I think it's probably part of a bigger subset of things that we're missing, like dysautonomia, because it's frequently associated. But there's no like blood test to order for that, right? So you have to use your brain, and there's not much room for that in
Is
medicine.
it true that it's more prevalent in taller young females?
Well, it's probably because they're probably hypermobile, and hypermobile humans tend to have that like long arm span, be lanky, long digits, long extremities. So it makes sense. I mean, if you look at the forest, it probably has to do with the fact that they're probably hypermobile. And hormones. I mean, hormones play such a big part in hypermobility because hormones affect your tissues. And so that's why men with hypermobility tend to be less symptomatic because the testosterone supports the strength of the tendons and muscles and ligaments. And so there's a podcast called Bendy Bodies with Dr. Blumenstein. She's actually an anesthesiologist who has Ehlers-Danlos and had to retire out from being an anesthesiologist because of her condition. She talks about how testosterone supplementation can be beneficial in some hypermobile women because of that, to give them that additional support.
The other conspiracy thing I wanted to ask you about.
Yeah, let's go.
If you ever dove into vaccines, did you ever look at the DDT poisoning and the polio vaccine ever?
I haven't. I have thoughts about vaccines and, I definitely think if I had a kid that had some sort of like seizure disorder, encephalopathy or something like that, I mean, those case studies are small, but they're not zero. And it certainly makes me ask a lot of questions. And I wish I would have asked more questions before my kid was pretty much fully vaccinated. I'm by no means, like I said, I'm by no means anti-vax. I think there's benefit and need for it in many places, but I think what essentially needs to happen ground zero is we need more research. We need to make sure what we're doing is safe, and we need to make sure that what we're doing is appropriate. And I'm not sure what you're talking about exactly. Just like I said, I just have vague theories on it, but I would love to hear more.
Well, like paralytic polio, which is like a common talking point, is like, for one, they say like 95% of polio is asymptomatic, and that actually the cases were decreasing at a pretty, astronomical rate prior to the vaccine being introduced. So there's this idea that, it's not an idea, DDT, the stuff they were spraying on the crops, causes what they were calling paralytic polio. And once they stopped doing that, polio decreased.
Polio.
Correct.
Do new studies.
Right.
Fucking do new studies.
Well, why do you have to be so ridiculed for saying something like that? You know?
Ego.
Can I ask you a question, and we can cut it out if you think it's too much, and I really don't want to get you in trouble, but have you been affected by any gender affirming stuff in your, even just on a, your own consciousness, conscience? If on your own conscience, have you been affected, with any hard decisions of anything being forced down your throat?
I feel like as a medical provider, yes, because I've been screamed at and told I'm being abusive for asking someone's, either calling them by the wrong name when they're transitioning, just simply asking. And I try to keep things very gray. I live in the gray, if you can't tell from all of our conversations. I'm not here to judge anybody, but I need to know, because I hear you that you're, female transitioning to male, but if I need to do a CAT scan, if there's any chance that you're pregnant and I CAT scan your baby, that's my license. And I get that you're saying But like, I either have to get a pregnancy test or have you sign a piece of paper. At the end of the day, it just is what it is. Like, I'm not being judgmental one way or the other. It's something I need to do to keep my license, essentially. Like, and people would argue that, like, well, if they say they haven't and they haven't this, I have to protect my license at the end of the day. It's a question. I'm just asking you to answer. And so there has been some of that, and it also comes down to anatomy. When people start doing hormones and things and transitioning, we were trying to get a Foley catheter on somebody one time, and it was a little more difficult because of the structure had changed. So yeah, I mean, in my job, has it affected me? Yeah, absolutely. At the end of the day.
Well, like, even because you're analyzing blood work. Mm-hmm. So how screwed up can blood work look, and how do you begin to decipher some of that information if you do have a 14-year-old female that's going to male, but they've been on some type of blockers? Is that change their blood work significantly to where, like, there might be something that would indicate a very serious cancer, but now you have to dive into and explain to them, like, this is literally what you've done to your testosterone, your estrogen. Is that ever a factor?
I mean, I can't really speak to that because I haven't had experience with kids specifically. I mean, the biggest one is like clotting factor increases with use of hormones. And that's probably the most applicable to what I've experienced is like, are you using any kind? And that's whether you're transitioning or not, is that it increases your risk of blood clots, which can be life-threatening. And so I don't know the answer to that, but I'm certain that when we go messing with physiology, it's going to mess with things. It's going to affect things in a way. Is it going to cause cells to mutate and increase risks of cancer? And you start looking at breast cancer and cervical cancer and prostate cancer. Like, yeah, I'm sure it does affect some of that. But again, we need studies. I think we need safety. I don't know if you're in. My personal opinion is like, I made some really dumb decisions before the age of 25. And I think allowing tiny humans and young humans to make big life-altering, forever life-altering decisions from a medical standpoint, and my personal opinion, is just not a good idea. Like, I have the dumbest tattoo on my foot that I got when I was 18. I thought I was smart and blah, blah, blah. No. Would I get that tattoo now? No. Like, but if it had been a matter of, like, I chopped my boobs off, like, you can't go back and change that. And a child's opinion when they're 10 years old, when they're 25, they're not even going to remember what their opinion was at that time. I think there's a gray area of how you can support kids going through that doesn't involve like such extreme measures, because at the end of the day, they might change their mind. And there are people who have done that and changed their mind. And that's just so sad that now they're like, my parents let me do this. Like, the medical system let me do this, and now I can't change it.
And the acute euphoria that's caused by initially taking testosterone. So they think, oh, I feel so much better. But obviously you do, because you're taking testosterone, exogenous testosterone.
Yeah. I mean, and there's a lot. This is part of my own conspiracy theory. And trans humans have a high rate of hypermobility. And when you get into hypermobility, is not just bendy joints. It affects every tissue of your body, and that includes your nervous system, your nervous tissue, your proprioceptors, that are the things that in your body that tell your brain where your body is in space, can give you a physical sensation of anxiety. It can give you a sensation of not feeling right in this world. And literally, it's like an energetic antenna, and it absorbs all the energy around you. And so for whatever reason, there's a higher proportion of trans humans, from what I've read, that are also hypermobile. And it's like, do those things overlap? Is there a reason for that? Like, are they simply searching some sort of like rest and digest, like trying to get out of a fight or flight state? I don't know, but my brain says there's some connection there as to why there are so many trans hypermobile humans.
I can assume that you're only correct. There's a predisposition of sexual abuse in these people. There's a lot of predispositions for it.
Yeah.
I know I wore eyeliner when I was in 5th grade, so it's like there's also the indoctrination factor.
Let kids explore.
Yeah. I don't know. It's wild though, but it's tough. I've definitely been ridiculed for what do they call that? wrong pronouncing people. Yeah, and it's like it's been accidental because like I'm not trying to get fired.
Yeah.
So I'm never doing it on purpose, but I've been like, well.
But it's also hard to like not call someone a dude or a chick. Like it's hard because your brain assumes based on what you see, and like there are people who are transitioning and they want to go by female, but bro, you look like a dude. Like I'm sorry, my brain sees a guy, it's going to say he. Like it's, you know, or your name is still Steven on the sticker. Like I'm just looking at the sticker. I don't know you as a human. I've known you for 5.5 seconds. Like my brain doesn't. It's a whole thing. Yeah.
Yeah, and then it's
I also don't want to get fired.
Yeah, no, I totally get it. It's also like a conversation of how important is it? Because people are like, well, did they say they were pregnant? No. I'm like, okay, so are we not evaluating females for abdominal pain anymore? Because the protocol says that I'm supposed to ask that.
Yeah.
So if they say no, I just say okay, or do I have to investigate now? Like, are we going by word of patient? I don't know.
Yeah, because ethically, it's like, okay, well, on the other side of it, like I was talking about earlier, it's like, okay, well, what if theoretically, and granted, this is probably never going to happen, but it might not never happen, that you scan someone who's pregnant, who is transitioning, and then they could go back and say, well, you didn't follow your hospital policy that says you either have them sign a waiver or you do a pregnancy test or you do whatever you're supposed to do in the ambulance because of medications and things like that. Like you give Toradol to a pregnant person, they could come back and say, that's why I miscarried. I'm going to sue you. Like,
right. Well, and your job obviously starts when the more definitive care begins. So for me, it's not as big of a headache. But
I mean, if you're given big drugs, they're probably critical, and it kind of is what it is then anyway. Yeah. But it definitely has affected my job, I would say. And I think the world as a whole, like I'm very much of the mindset too. I'm like, if you're a grown ass man and you want to dress up like a woman and wear makeup and do whatever you want to do, that's fine. Do that. Do I feel like there's some safety repercussions with like children in bathrooms with said situations? I think maybe we go to more single bathrooms. Like I do think there's a safety component. It does concern me, and I'm not saying every person that does that. I've met some very nice trans people that I would go out and have drinks with. You know, I'm not a judgmental person at all. I think convince me. Like, you don't have to convince me. Nobody has to do anything for me. But live your life the way you want to live it without having to make it my problem. Like, I don't want your life to affect me. Like, I don't want someone, like, having to prove themselves to me. Well, I'm a female and blah, 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 blah. Like, why are you so angry about it? Like, clearly you've not come to terms with whatever you're trying to work through, like, nervous system-wise. We're going back to that. And it's like you're putting your discomfort out on other humans. Like, if you want to dress up like a woman and you're a man, go for it. Don't make other people unsafe. Don't make other people uncomfortable. Like, you don't walk around telling people you have a penis. You're a dude.
You don't know that.
Like, you don't. I don't. I shouldn't assume. But, like, the point is, if you're a chick dressed up like a dude, you're not making it my problem right now. Right? Like, and you don't need to tell me that. Like, I don't give a fuck what you are. If you can be a good human, a decent human, I don't care what you're doing. But it's when you get loud about it and make me feel less than or feel bad for asking about a situation because of my job and like the physiology of the situation, like getting really cerebral about it. Like, we have to. That's our job. We're taught to do a thorough job, an accurate job, and this just adds to the confusion. And I'm sure there's some CEU or course that they're going to make us take at some point. But
yeah, they've set up a parameter. Is kind of a derogatory term, but the people who support that movement have set up a parameter or a fence where inside there you have to validate them, but once you cross in there, they don't give you any validation and only dismissal. Yeah. And that's the biggest problem I have with it, because I'm the same way. I don't really care what you do. You know, I have my own personal opinions, and that's what it is. But
be a little forgiving if I've known you for 5 seconds and I slip up.
And I've never been validated on my opinions. I always have to validate the other person.
Yeah, I think to each their own, man. Like, stay in your own bubble, and like, I can appreciate you as a human if you're a decent human and keeping things safe. And it doesn't need to be a discussion. Like, if you want it to be a discussion, have that discussion with the people that want to have that discussion, but don't don't be angry and make other people feel bad because they don't agree with you. Like, not everybody's going to agree with everybody, and we just have got to let that go. Like, it doesn't matter what the fuck the issue is. It doesn't matter if it's vaccines. It doesn't matter if it's trans. It doesn't matter if it's medicine or Western medicine or functional medicine or whatever. Like, just fucking let it go. Live your own life. Stay in your own lane. Support people where you can, but give grace to people that don't agree with you. And you don't have to associate with those people. You can do your own thing. And your life's going to be a lot better when you surround yourself with people that support it. If somebody doesn't support you dressing up like a woman and doing steroids and whatever and transitioning, those aren't your people. It doesn't make them bad. It just means they're not your people. That's just how I feel about it.
I couldn't agree more. Tell people where they can find your services.
My services, as much as I hate social media, I'm on social media. Facebook, I'm Allie Jane. I've got some groups where we get a little more in depth with some free coaching resources. The Inner Compass Academy. Feel free to go join that up. I also have Double Jointed Wellness is kind of my hypermobile side of things. So if you're bendy, come on. And then also on Instagram at Coach Allie Jane, TikTok at Coach Allie Jane. I mean, I am all over the place. I talk about parenting, ADHD, being an ER nurse practitioner, being gaslit in the medical community, advocating for yourself, nervous system regulation. I mean, chaos, utter chaos. We're all over the place. That's where you can find me for sure. I don't have a set up website or anything like that. I do, first coaching call if you need some support, free. It's always free. The first one, we just chat for an hour and see what's up. I don't push people into coaching. I'm not somebody who's an MLM, oh my God, I got to get you into this to funnel you into my blah, blah, blah. I want to help people that want help. And if you need 60 minutes of breath work to just chill your shit out, let's do it. I'm happy to support you. And if that's something you need in the future, you know where to find me. I just think everybody needs a break sometimes. And when you think about going to therapy or doing this or that, something formal sometimes feels more you put it off and you're never going to do it. Whereas just hopping on a call with me to do some breath work or meditation or hypnotherapy, you want to do some past life regressions, you want to just sit here and work some shit out, let's do it. There's just no pressure in my space. I don't like pressure myself. I vividly remember trying to buy a stove in the middle of COVID because our kitchen was a mess and being pressured by somebody look at this one and I want you to come over here and look at this one. Colby thought I was gonna murder the guy. I was just fucking stop talking to me, stop messaging me, stop calling me. I'm not gonna be up anybody's ass. I just think it's a space to take a breather, and every single client I've had come into a space, any kind of coaching call with me, has just said it's just relaxed. I feel more relaxed after whatever we've done, whether it's just coaching or breathwork or whatever. I think more people need it, and coaching and therapy, I would like to add on, coaching and therapy are not the same thing. Therapy is very it's very structured and it's very, let's dig in, you're truffle pigging, trying to find where that stuff's coming from and this and that. And we do some of that, but it's very much coaching is very much more, we acknowledge that those things are there, whether we put a name on them or not. And it's less talk. It is talking, but it's less talking. Through the somatics and energetic work, it's allowing the body to do the work. So through breath work, allowing the body to do the work to move that shit out. So you don't have to talk about it. And then if you need to talk about it, you can. It's just a lot more relaxed, a lot more goal oriented, versus therapy is let's just talk about it. And it makes me think of a dog rolling around in the mud. Whereas coaching is just okay, I see the prize and I see the gap and I want to bridge that gap. And that's what coaching helps you do.
Beautiful. Well, thank you for help driving the movement for functional and holistic medicine. I think it's incredibly important, and you're taking on a lot. So I hope you keep your head above water. And really, I appreciate you so much for taking the time to talk to me.
Thanks for having me. Jack of all trades, master of none, man. It's just followed me throughout life.
Yeah, there you go. All right. Thanks, everybody.